So if you want to be an inspiring brand like Nike, ESPN, Apple, Infinite Motive, then I think you got to show who you are.
I agree with that. I think that's ultimately that'll be the goal, is to be as much of a household name as those brands.
Yeah.
And it'll be in my own niche of, cancer awareness.
Right.
But I want it to be that recognizable. And the only thing that I can think of that has even remotely scratched the surface of that would be Livestrong, which, had its hype with the wristbands back in, was it the early 2000s or whatever, which it was a great idea, but they didn't expand on it in a way that it became a culture of clothing or anything like that. It's like the wristbands, I'm sure they had some shirts and stuff, but you don't see everybody walk around with Livestrong.
Right.
And I think that there's a hole waiting to be filled with a brand that feels all-encompassing. Everybody can wear it in support of this thing, and everybody can look at that logo and immediately recognize, oh, that's for cancer awareness.
Right.
And it doesn't have to be a ribbon, and it doesn't look like you just ran a 5K and you got a free shirt that
right.
says like, let's beat cancer together,
right.
or something. I think there's a cooler way to bring it across to people, a more welcoming way. And the other thing is, I think it can be all incorporated under one roof, which nobody does. Everybody kind of breaks themselves off into these cliques of different cancers, and they're like, this is our cause and this is what we're fighting for, which is great. I'm glad that they do that, but there's no place you can go that is going to kind of be supporting everybody all under one name.
Right. From the patient's point of view, sort of. Like a patient,
extent, yeah.
Meaning you want to be inclusive of every cancer patient. So if you're supporting one cause, which is a great cause, it might not serve all your patients,
right.
the types of people you're going to serve.
Yeah.
Therefore, you need to be more inclusive in terms of working with different organizations, right? And
absolutely
offering something that can serve everybody.
Right. And I mean, if I would have gotten through what I did and I just started a leukemia-based clothing line, then, I mean, yeah, it would be very narrowed down to that group of people. But there's just so many people that aren't being spoken for or even given an opportunity to be like, oh, I'm also a part of this,
right.
this much larger problem that is cancer.
Right.
And
especially the support team around you.
Right. Yeah, and that's the other thing is I know that for people that are supporting from not even one level of like caretaker, but like, friends and family that aren't there on the day-to-day, they want to be able to support somehow, but they also might feel like imposter syndrome if they're going to wear a cancer shirt and they have nothing to actually do with it other than knowing somebody. And with something like this, it's more, you could say that the logo's kind of more corporate, but it's also making it more uniform for everybody to feel comfortable wearing it.
Right.
And it's not screaming cancer in your face. It's just kind of, oh, I know that symbol from
right.
this. And I think that, that getting away from the ribbon and seeing that there can be other designs that can still represent
right.
these things is going to be helpful.
So can you explain specifically what your company's going to do? Like, you're selling merch, and then are you helping to fund treatments? Like, what are you guys
So
planning?
Initially, just because we're starting this, just me and my mom, basically, we have all the organizations that relate to each type of cancer, so that if anybody buys a kidney cancer specific shirt, it's going to go to a kidney cancer foundation.
Got it.
That we're already, we have it all listed on our page, all the foundations, and it'll go to them. That's initial.
You're working with different foundations, and depending on the merch you sell, part of the proceeds go to that
10%
foundation.
of net proceeds will go to that.
Cool.
And so that's great initially. We both want to turn this into something where it gets way more personal. I want it to be, we have this chunk of funds that have been raised, and now we can go sponsor a family, or we can do a direct, donation, rather than, not that these charities can't be great and everything, but you never really get to see where your money goes. And I know people want to see that.
Sure.
And I would love nothing more than to know I'm directly influencing this family's life.
Right.
And possibly saving their life. Who knows what you're giving them. But I know that just going through my own treatment and seeing how my mom dealt with it, I know that the smallest bit of help from a stranger can change your world. And it doesn't have to be something drastic.
Right.
So I can't even imagine what, a check for $100,000 can do for a family that's going through this and their life's been blown apart.
Right.
So it's that the long-term goal is to really get more personal with it. Initially, to get these things started, we're working with all these foundations as a portion of the proceeds.
And then you can allocate the money for that individual patient. You can say, hey, we've got $80,000. Let's see, what do you need? And it could be anything they need across the board: transportation, medicine, a nurse, anything out of pocket. You guys could
All
do
of
that,
it.
right?
Yep.
That's cool.
And that to me is like the ultimate dream, is when we could get to the point where we have these stories shown of, you know, these lives
Right.
impacted. And because right now we have the tell us your story portion of the website, and you know, it's like we need to rely on these people to be willing to be brave enough to take a picture of themselves in the clothing, send in their story. There's like, you know, there's a lot of steps that they have to take that we're hoping to build a community off of. But I understand the hesitancy. You know, if I saw that, I might be hesitant too at one point if I'm just starting my journey. It took time for us to realize that this is like a missing part of, if you go to any cancer center and you look at their memorabilia, it's like, it's just branding for that company. If it's MD Anderson, if it's City of Hope, if it's these places, you're just seeing their branding and that's what you can buy there.
Right.
But you're not really getting this like authentic, personalized experience that you can get with buying through, you know, it's a personal story that's become something larger, and now trying to create a culture around it. And that's why I call it cancer culture. And that actually, you know, it came to mind. I was listening to it was a podcast, Andy Frisella, I think.
Yep.
And he was saying cancel culture, but he mumbles kind of.
Right.
And he said, and I thought he said cancer culture, and I was thinking about it for mine. I was like, that's exactly what this is. And it makes people think, because initially when you think cancel culture, you go to a negative thought, but cancer culture is literally what Infinite Motive is. It's
Love it, man.
It's all encompassing.
Yeah, it's almost like a great sub-brand.
Right.
Except it's a little more in your face, which is good because you're being direct. And so the clothing, Infinite Motive, that's just so much more generally appealing.
Right.
Infinite Motive. Why would you not wear that, right? Whereas somebody might go, well, I don't want to wear this cancer shirt. People are going to ask me questions or something like that. So I get the direction you're going.
But it definitely triggers the thoughts for people, because I see people when I walk around, people look at it for sure, because it stands out. It makes you start thinking about it. Every once in a while I'll have somebody approach me because they've had cancer and they want to know, you know, what does that mean? And it's perfect opportunity to plug things like that.
Couple of suggestions, if I may. I know it's a podcast, but
Tell me.
I love cancer culture. I mean, I don't love that there is a cancer culture. I love the idea of creating a cancer culture, man. I think it sounds great, right? It's like a great brand. It sounds like a great brand. And I'm not saying, I like that it's not the headline, because people can buy other stuff, but I would definitely promote that hashtag cancer culture.
100%.
And the idea is, you know, put a little, I've seen this before, so it's not really new, but put a little QR code on the back. Mm-hmm. So if someone buys it and says hashtag cancer culture, there's a QR code. Maybe it says like, find out what that means. Right. And you go, wow. Yeah. And maybe someone you know going through it, and then, you know, you go, boom, someone's behind you. They go to the website and then go, oh, this is really cool. I can help the cancer culture. I can help the nonprofits, and I can buy some cool gear and support. The other idea, real quick, so I don't forget, is until you get to that level where you can like fully support a patient and fund a patient, to show up at, you know, hospitals, treatments, handing out merch. Like, hey, we want to give you this like sweatshirt. It's going to keep you warm.
That's what I've been looking into through the social media, is trying to find these people that are going through it and saying, hey, I'll send you, you know.
And would you be willing to tell your story? That's all we ask. We don't want you to pay for it.
That's the goal.
Can you just help us like spread the word? If you like, can you support us? Like, just, you don't have to be on the film if you don't want to be, if it's privacy, but can you just say, hey, thank you so much, Infinite Motive. Like, I appreciate this. And tell us what you think. Like, hey, I don't like the fabric. I like the fabric. Like, one of the greatest things you can do, by the way, as a business, if you're a fundraiser looking for investors, whatever you're trying to do, is, hey, would you mind looking at this and giving me feedback? Right. Instead of, hey, what do you think about buying this? Right. Just say, hey, can you just give me feedback? And be really open to the feedback, because they might go, hey, have you thought about using a supplier and blah, 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 blah? And you're like, wow, I never knew that, right? Or they might say, wow, this is really cool. How do I get one? Right, exactly. Yeah, but you're no pressure. And if they don't say, wow, how do I get one? You just like go, oh, thank you for the feedback. Really appreciate it. Or can I give this to you, but can you give me feedback? And can I record some content to give people feedback on what you think of this shirt? And then, you know, Most people will like it if they get something, but
Right.
hopefully they'll be like, wow, this is fucking cool.
Yeah,
And amazing.
the setup right now is what does Infinite Motive mean to you? So that's kind of, when we ask for people for a story once they get product from us, it's hopefully they tell their story, and then hopefully it kind of wraps back around to, okay, what made you feel like this is something that you can wear and feel comfortable in, and it represents you in some way that the everyday cancer clothing isn't going to look like.
Right.
Wearing a shirt that says fuck cancer it's bold and in your face, and I think initially there was a place for it, but that's not the bulk of people wanting to wear things. It's just it's
Right.
too much.
Right.
An old woman's not going to be looking to wear that unless she's she might be a different personality, but that's not the common. And so I just know that through something like symbols like this and unique designs, which that's my background, is I was a graphic designer. That was what I worked in prior to everything. I think that I can get that across through just kind of spotting trends, knowing what people are comfortable wearing, towing the line of an edge, and kind of using streetwear brand techniques, but still not trying to do anything like boldly saying profanities or anything like that.
Yeah.
And I just don't think it's necessary.
Well, personally, I really enjoy positive spins. So I really like that, and I agree with you. Like if I was in charge of deciding which route, an organization such as yourself went, I would be like, turn the negative into a positive. Right. Turn it into motivation. Turn it into telling your story, whatever you went through, as motivation for you. Even if, whether it's a survival story or just somebody's story of what they went through, that's motivation for you to live fully. Even if you're not suffering with cancer, or to go, wow, I have infinite motivation knowing how lucky I am to be healthy. You know what I mean? There's so much positivity that can be taken from negative things. Right. So much strength you can take. You know what I mean? Absolutely. And I think that's a great segue for your origin story, which you've told me before because we did sit and talk. Right. It wasn't recording great. So, and I feel like you've evolved since then too. I feel like it's a more...
I think it's more put together.
It's more. There's more clarity now, probably more confidence.
I think so.
More courage. The 3 C's that you need. So now it's a more interesting conversation.
It is.
Because why? Why did this all happen? Let's reverse, right? Like, right. Go back. When did you get spawned into this game?
The interesting part, whenever I have to explain the entire beginning of the story, is I never know where people really want me to start.
Where do you want to start? I want to know where you want to start.
I think in terms of starting with the most relevant parts of it would be, because I think that one of the biggest, I don't want to say causes, but possible causes of people getting cancer could be stress. And I think that if you aren't finding a way to handle your stress properly, you could really be looking at it. I mean, cancer is just one thing, but you could deal with all kinds of, health issues.
Let's fucking go. Done. This podcast is done. Dude, no, seriously, dude. I love that, man. Because that's something you can control, and it can't hurt. Even if you're wrong, which I don't think you are. I think stress is a killer. I think people know that by now.
Yeah, stress equals inflation.
I'm surprised. Yes, I'm surprised you said it. Like, I wasn't expecting that to be the first point, but I think that is such a great point, man. Yeah, because that applies to everybody.
Everyone, and I don't think it's a matter of do you have it, because I think everybody has stress.
Right.
And it's going to be varying levels across the board, but everybody in some way, shape, or form is dealing with stress. And if you're not dealing with it in a healthy way, then you're dealing with the negative outcome from it. And so for me, I was working in a high stress environment leading up to my diagnosis. It was with a company that I'm forever grateful for, and I loved the people there, but the pressure that I was putting on myself, mixed with, just buying my first house, mixed with the expectations of the people around me, this perfect storm, and I'm putting the ultimate pressure on myself. I wasn't taking care of myself mentally, health-wise. It's funny because I was in peak shape of my life. I'm constantly going to the gym 5 a.m, going straight to work, cranking away, but I wasn't taking care of myself mentally. And I think that had a role to play I think it started out as me thinking I had sinusitis and, some kind of sickness that I, got antibiotics prescribed for. And the saving grace is I had a few days earlier moved chairs out of a truck for my company because we were getting new office chairs. And I think I had pulled my back, like somewhere in my spine, something went wrong. But the pain that came from that later on made me wonder, because I was getting so sick. I was like, is this spinal meningitis? Like my dad had spinal meningitis. Started running through my head. I contact my parents. I contact my sister, who is a doctor, and they're like, just go to the ER. It's better to be safe than sorry. Who knows? Nobody thought at that time anything like this. So and I'm already missing a lot of work. I'm stressing. I know that if I don't find something to work, I might lose my job. I'm really not wanting to go to the hospital. I don't want to have to start paying for, visits, any of these things. But I go and I tell the guy at the front desk that I think I might have spinal meningitis. This is why. And he's like, oh, did Google tell you that? That was his first response. And it was like, I wish I could go back to that guy now and be like, you know what, I was wrong. It was actually leukemia, my bad. But, so sorry for your...
My bad.
Yeah, didn't want to
I would love
hassle for your day.
to see the look on his face if you ran into him.
And so I go in there and they immediately take me in and they start running blood tests thinking, okay, we have to rule that out. And I'm thinking, man, I'm going to spend so much money for a useless visit to the hospital. And next thing I know, it takes awkwardly long time. Finally, somebody comes back and they're like, you know what, we want to just run some more tests to be sure. We're not really sure. So I get moved to another room. And then, over time, oh, no, you know what, we're going to run a bone marrow biopsy to rule out cancer. So that was the first time they bring that up, and everybody, of course, is just like floored that this could even be a possibility. And it moved so quickly from the time that I got into the hospital just as a checkup, turned into I think it was like 33-day stay in the hospital. I didn't leave after that day. And it went from, just checking up, rule out cancer. Oh, it is cancer. And not only is it cancer, but it's 80% of your blood, and we need to start chemo yesterday. And my mom asked, do we have time for a second opinion? No, we're starting chemo. She was like, he's getting his chest port put in at, I think it was at midnight, if I remember correctly. And then I started chemo the next day. And, my sister and her husband fly in immediately. They actually witnessed the first round of chemo start with me. They got in there just in time. And it was like living a car accident just at all times, because you don't have time to catch up thoughts wise to everything. You're just getting thrown in, testing here, this surgery, that, and you don't know what any of this means. I mean, I knew what leukemia was. I knew leukemia was really bad.
Right.
That's all I ever
We've
knew.
heard of it.
Yeah. I was like,
That's
if you get that,
that's
things
not
are
good.
not good.
Kids get it, right?
Exactly. And that's the other weird thing, is that usually it's kids or really old adults.
Right.
Being in my age range was very strange for it.
That's why anything can happen, man.
Exactly. And it was as terrible as it was for me. Nothing hurt more than watching my parents go through it. That was an absolute nightmare. And my mom was with me every step of the way. I mean, both my parents were, but my mom was staying in, as a caretaker inside the hospital. And it was one nightmare after another. And the idea was that I was going to try to beat it with chemo normally. But if I don't, I need to have a bone marrow transplant. And they don't do those in Las Vegas. So now it's on my mom to find out, who's going to do it, how are they going to do it, who's the best at doing these things, this thing that we didn't even really know anything about prior. And so we end up, MD Anderson in Houston was the place that #1 ranked cancer center, that was the place to go. Ironically enough, my sister is in residency doing rotations I think it was children's oncology at the time that I'm getting diagnosed.
Wow. So she's dealing with leukemia patients, basically.
Yeah, all kinds of children's cancer, and I end up going to the place that she's doing, rotations.
Oh, I didn't
at
realize
the time.
it.
Yeah,
That
so it was
probably helped a little bit.
There was so many things that helped, and were just so crazy that it worked out for as bad as the situation was, because so many things had to go right for this to work out. And all I could think about the whole time was, how does anybody that has no support system or no family to help How do they even remotely do this? How do they deal with the paperwork? How do they deal with
Right.
insurance? How do they deal with any of it?
Because you got to deal with the treatment that's knocking you on your ass. I'm assuming.
100%. Yeah.
Big time.
Yeah. So I started with the first initial round was, I believe it was called 7+3. It's 7 days of continuous chemo nonstop, just running bag after bag, and with three shots of it was called the Red Devil. It was I think doxorubicin. And basically
Red Devil.
Yeah, well, if the name's not bad enough to give you an idea of how bad this stuff is, they told my parents that if I go to the bathroom, I need to flush the toilet twice, because if they go after me, the chemicals from what's going through my body could affect them, either hurt them skin-wise or whatever.
Like a rash.
Yeah, whatever. But
just
basically
the
that tells you how
from
toxic
the fumes.
this stuff is. Yeah.
Jesus.
And so, of course, I went through that, lost my hair. I had never experienced exhaustion at that level in my whole life. I thought it couldn't get worse, but you find out later that there's always worse.
Yeah.
And so I got through that first bout. They said
So tell me about that. And also, I'm also getting emotional, I think, because of the parent perspective.
Your father, yeah.
Like,
absolute nightmare. It's the worst thing that could possibly happen. And that was, like I said, what hurt the most for me, because I mean, I would take this over my mom getting it
right.
any day of the week, but watching her go through it it's
and all your lives completely flipped, upside down,
yeah.
And like you said, you had support. I'm sure that's a big motivator for you to help other people.
100%.
Tell me about the bone marrow. Like, why bone marrow? Just to teach me a little bit. Like,
it's
leukemia. Why a bone marrow transplant?
It basically, the cells that were being produced in my marrow were cancerous.
Okay.
So, and inside your marrow, your immune system is basically, being produced inside of there.
Yeah.
So not only you're not going to be able to fight anything off, but then eventually it's gonna get into your organs, cause organ failure. That would have been the next step. If I hadn't caught it when I did, it was already peripherally in my blood a lot.
I see.
But once it gets into your organs, you start going through organ failure. That's usually when things are really bad. If they catch it at organ failure, a lot of those people can have a rough time making it.
Yeah.
So luckily, I mean, in some sense, I got in soon enough. I needed to put the chemo in my body to kill everything in my body so that I could restart it.
Right.
It's almost like a power on-off switch for your body. Hopefully when we restart, there's not going to be cancer there.
When you say restart, the blood basically is flushed out, so you have fresh blood, and you hope that
right.
it's
and so
strong enough to...
While that's happening, to flush it out and to kill everything, you need to take yourself as low as you can to zero across the board, just
as a human, as like organs functioning,
like
everything,
like your white blood cell count, everything to like zero, and that's how you can
kill the cancerous blood.
Well, that's the idea,
right?
And so I go through that first round in Las Vegas. It went successfully from what we could see on the surface, but then I had a biopsy. She said that it still looks like it's going to come back. We fly from Vegas to MD Anderson. I think I maybe spent 3 days at home before we moved everything. My dad's moving, our whole house into storage while me and my mom fly to Houston to start the process. That's when I truly understood that there's medical centers out there that are practically cities. I mean, it's the biggest medical area I've ever been in my life, for sure. Anything you can think of, they have it. The resources there that's the first thing. If I am ever told by anybody, oh, I got diagnosed and I need help, what should I do? My first thing is, can you get to MD Anderson and start there immediately?
Gotcha.
And that's the first thing that was told to my sister and her husband when they started talking to other doctors. They were just like, get him to MD Anderson.
Got it.
That's what you got to do.
Good to know.
And ultimately you want to go somewhere where they've seen more of this case than anywhere else.
Right.
And the cancer center is going to be the place.
Yeah.
And so fortunately enough, through my company allowing me to continue with my insurance, I was approved to go there. and then started the journey of consolidation, which was going to be, I think, 4 rounds of chemo. It was 2 weeks on and then 2 weeks off, basically. And I did some clinical trial drug gemtuzumab, which was like very hard on my liver. At the time, they told me you're never going to be drinking again. Luckily, that recovered, but it was. But you have no choice,
Right.
People are like, "Oh, how are you? So brave to do that?" It's like, you know what
You
the
don't-
other option was,
Right.
You know what I
Right.
mean? Like
It's an
not a
easy
whole lot.
choice
Exactly.
when death is facing you.
And their hope was still that I can possibly beat it without getting a transplant.
Mm-hmm.
And so we start this process of these 2-week stays where you check in like it's a hotel, but you're there to just basically get chemo and live in hell for a while.
So
And
take me through the process, like as a scene in our movie, right?
Okay.
We're doing the podcast. You're telling the story,
right.
painting the picture, and then later someone will go, "Oh, let's do an animated scene of what it's like."
Yeah, I can do
Even
it.
to get people to go, "Okay, what is it like? What am I in for?" Somebody got diagnosed. You're like, "Hey, go to what is it, MD Anderson?"
Andy Anderson, yeah.
Right? They're like, "What does that mean? Why?" So paint the picture, I guess, of the treatments. Like, what does that mean?
So
I know but nobody really understands until they go through it.
yeah, it's 100%. So basically, you're gonna pack up like you're packing up to go on vacation, but it's instead you're gonna be in a hospital room for not. And okay, I should preface this with, all cancer treatments are very different. This is specific to leukemia, blood cancers, kind of. Everybody's gonna have a different experience,
Right.
Mine was inpatient. A lot of people get their chemo and go home,
Right.
which is, with this kind of chemo, it's not possible.
Got it.
So basically, yeah, you pack up.
Would you say this is the most challenging form of chemo?
It's the hardest that you could possibly take.
This is the ultimate, because there's different chemos. Yeah, I know
100%.
people that have gone through cancer treatment, outpatient. It's
Right.
still very hard. Takes a toll on their body, but you can go into maybe more details.
Yeah, it's
Like this is the worst. This is the one you see in the movies where it's like totally depleting
real bad.
you.
Yes. So it's what they do is they take an assessment of what physical condition you're in and what can you handle to take. And the healthier you are, the higher the dose is going to be. The harder the dose is going to be. They're gonna hit you with everything.
And you were pretty healthy, so you were taking it on the chin.
Yeah. And so
Give me another.
It's like you're torn, right? It's like being in the best shape you've ever been in saved your life, but it also
Right.
got you hit with the
With the
absolute hardest.
Give me another, doctor. Pow! Oh,
Exactly.
another man.
And so,
How did it feel? How was the feeling?
so when you're getting it, it's like a transfusion.
So you just
I have a
lay-
chest port.
Okay.
It's just flowing in.
Okay. What does
You
that
have the
mean, chest
bags.
port? It's
A
just
chest port is
left in there?
It's an access point that's implanted into your chest, and that tube goes into your heart. So that, because what happens is the kind of chemo you're getting, if you got it done through your veins like this, your veins would collapse. It can't handle that kind of.
Damn.
You need it to get distributed from your heart.
Isn't your heart
out
on
to
this side, so it goes in here and flows in there?
like
an
the
artery or
scars
whatever?
right here. So it was basically, if you saw the X-ray, it's a tube that runs like that,
Oh, damn.
and it goes is like a arch. Kind
So you had to
of
get that
goes in.
implanted first.
Yes, and that was back in Vegas, right when everything started. That was immediate. That was before
Yeah.
it started chemo.
And you were under for that, I'm assuming?
No. This is local anesthetic.
Oh.
And you have like a curtain right here. They cut open. They push it in.
Did you take a peek?
You want to, but it's it's actually, that process was way easier than the removal of it. The removal of it sucked.
Yeah.
But so basically, yeah, you pack up for 2 weeks in a room, and you're
Miles always does that.
and you start it. You have to go through all the paperwork and all the preliminary stuff, but then you start getting going. And people always think that it would be while you're getting it that the problems are happening, but really what it is your body needs to start processing this poison. And so what happens is, by the end of the 2 weeks, you're starting to feel pretty bad, but it's not till you go home that you're really, it's called nadir, NADIR. It's like your lowest point, your body's lowest point. And it's when you're going through hell. It's just,
Damn.
and it's not like, you're not sent home and then just free. You're sent home to come back at 6 a.m. every morning, get your blood drawn, if your platelets are too low or your red blood cell count's too low, you're going through transfusions. And you don't have a choice about getting there early, because if you get there any later, you're on a waiting list that's going to put you till late at night to get a transfusion. So your best bet is going there still dark outside. You still nauseous, still want to throw up, but you're driving to the hospital to get your blood drawn and see what the results are.
Because they're monitoring you every day.
Every single day. And
nadir is the condition.
Nadir is
of that
is the
pain
is the
or that effect.
It's the time of where your body is at its lowest.
Nadir. It's a medical term, not necessarily related to chemo, just nadir. Or stands for something.
I don't know if they use it in other medical terms, but it's for sure considered the lowest point during treatment of chemo.
Yeah.
That's
the reason I thought of it, totally random. Sorry, but I just thought Ralph Nader. No, I just thought when we write our hit rap song, we got to use Nader in that.
Okay.
Just the term that Nader, like hitting your worst possible, lowest possible threshold. It's like a metaphor for life. It's when we learn the most. It's when I've learned the most, when I hit my low point in my life, when I got divorced and separated and like started all over.
That's a
my
good
life.
point. I don't. It could translate to that too.
Yeah.
And if it doesn't,
don't be a hater. Embrace the nader. Right.
See you later.
See you later. Damn, dude.
Yeah,
so that's such a. You went to the. You see. Not everybody gets to go to the Rubicon. The no cross. The point of no return. Of that type of pain that gives you a perspective that you cannot get unless you go through it. I'm not recommending it,
right?
But you had to do it, and you got to do it. Just very curious about it. I know we talked about it before, but we never
when I
posted
look
that.
back on it, it's the most developmental portion of my life ever, for sure. I mean, there's no time in your life where you're getting to grow this much mentally. And getting to, I mean, you have no choice.
Talk about
actually,
that.
you do have a choice.
You have a
that's
choice.
Actually, part of it is
you have a choice.
It's
and by the way, your mom Lori is gonna be next on the couch. I'm realizing, because I gotta tell the perspective of the parent, because to me that would be so interesting.
I think we should definitely do that. That would be great.
Yeah, right. For Infinite Motiv, are you ready?
As ready as I can be. I'm ready for anything.
That's right.
That's what I'm saying. You've been through the nadir. You've been through the
well
nadir,
equipped.
Lori. Not many people have been through the nadir. Don't be a hater.
Embrace the nadir.
Embrace the nadir. Hey, you either embrace the nadir or you get killed by the nadir. Because if you're mentally not in the right place, let me ask you a question. It's a very dark question, but if you didn't embrace the nadir, would you have made it through maybe? Like, could that be the difference? Like, if you were like, I can't do
I
this
can't
is
say
bullshit,
whether I would
why
have made
me?
it through survival-wise. I can say that what happens when you have that fork in the road is that you can become a very bitter, dark person. You're a victim to everything. You just take everything in that way. So yeah, I might have survived, but you become poison as a person to deal with, really.
Look, it's one thing, just gonna say this is interesting. There's one thing to be a motivational talker and a positive thinking talker when you haven't been through the nadir, and it's another when you've been through the nadir. So that almost automatically graduates you past anybody else that's trying, not that you're competing,
right?
But I'm just saying what a great perspective you, sir, have that I luckily don't have, but I get to find from you and my other buddies that have been through different but similar struggles,
right?
Because it's such a fucking amazing perspective, dude. It's like the ultimate in getting to that next level of positivity. If you can be joyful in that somehow, then you're a winner. It doesn't matter what life gonna do to me now.
Right.
Shit, I've been through the nadir. I've been through the nadir. That should be a damn T-shirt. Yeah. Sunny days. No, seriously. I've been through the fucking nadir. Don't say fucking.
Yeah.
What's nadir? What is nadir? QR code. I've been through the nadir. I want to see, like, go deep with your T-shirt. I love making T-shirts. Let's have a T-shirt session. I've been through the nadir.
I would love to.
And I want to dig in your brain because you've been through the nadir and I haven't. So you're gonna come up with the good shit. Yeah. Oh my God.
With our powers combined.
Wow. I've been through that. I really like that. And I would wear that. And people, what's the nadir? Well, honestly, I haven't been through the cancer nadir in terms of cancer culture.
Right.
I know people that have, and that's somebody you need to talk to. Go check out the podcast. But I've been through my nadir, and I survived, and I could have not survived. I can see how people can go very dark when I was in my bottom.
Yep. Well, and all you end up doing is hurting yourself in the long run, because you're just ultimately boxing yourself away from everybody, and nobody wants to deal with you because
Yeah.
of how you handle
Right.
It's,
I'm going through a mini nader right now with these last 2 weeks. Yesterday was like the culmination of that particular mini nader. Sometimes there's mini naders in your life, you know. It wasn't that big of a deal compared to this.
I,
But the point is, man, I got through it so much quicker than I would have as a younger person. Feeling sorry for, oh, poor me. I gave so much to this person. They didn't give it back. Oochoo, poochoo. Move on.
yeah,
Worst things can happen.
and that all happens through introspection. It's not like, none of the answers are ever going to come from the outside.
Right.
That was never.
Except good podcasts with I'm just kidding, people that have been through the nader. No, like, good. Honestly, somebody that is a master in something, like the nader, going through stuff, or somebody that knows chess, you can definitely learn. But at the end of the day, you got to put in the work.
Yeah.
You're still not going to be good at chess reading the book. You got to read the book and go, oh, I never thought of it that way. And then you got to practice it.
Right.
You got to practice being positive. You got to practice being introspective, going, wow, I blew up with that person. Why? Did I need to?
Yeah.
My, lifelong
But
struggle,
having
as you guys
having
know.
the awareness to be able to reflect like that is the first part of it.
I may never get to a 10 in that category, but
If you're
why
already
not?
having that thought, though, that
Yeah.
means that you recognize it.
And it's a slow climb, baby,
That's it.
sometimes.
Yeah. But I think that's normal for everybody. Everybody's got this journey that we're on, trying to figure it out.
Yeah,
And I got put on a fast track to it,
exactly.
and it wasn't my choice. But I told my parents I'm always going to be grateful for this experience.
Mm-hmm.
I made it out of it. Like, we've grown so much together. We've created Infinite Motive. We have an entirely different view and perspective on life. We know things that we never thought we would even encounter,
Right.
and it's priceless. That's
Yes.
what it is. It's
So talk about that. And by the way, and Lori, you should sit and sit survivorship anxiety. Ooh, survivorship anxiety.
yeah. That's a
See,
that's a
you
big
could
one.
stay here. By the way, you don't have to go over there if you want. I'm not. But
Yeah,
I
wherever
like
you
the energy's good because you're part of this story.
Oh, she's definitely
Yeah,
part
yeah.
of it. Survivorship anxiety, man. That's that's what my day to day is now. Because
Talk about that.
it's well, what happens is that everybody sees that now. If somebody sees me on the street, they'd never guess that I had cancer, that I've been through what I've been through, and so you have this. You feel almost like a ghost because you're not seen for who you are and what you've been through, and it's almost like once you're not dying from cancer, people really change up on you. It's everything's just fine now. Nobody
Right.
nobody thinks about what the damage is inside your head, inside
Right.
your body. It's everything's just he survived. Everything it's great.
And you look normal.
Exactly. And
It's like people that have been post-traumatic syndrome, right?
same exact thing.
You came back from Vietnam. You look, man, shit. You look good. You actually look really good. You must be fine.
That's
You're
the
talking nice.
best
So
comparison is people
yeah.
that have gone to war and come back.
Wow.
And so you kind of feel like a stranger forever after that because nothing's ever the same.
Wow.
And that's a big thing that I try to get across to people. I actually just recently went and talked to a girl I know. Her older sister got diagnosed. It was multiple myeloma and leukemia, I think both. And she was actually in the hospital for an infection. So I went and talked to her parents and her at their house. And they said, what's the one thing you can tell us as a takeaway from it all? And I said, don't ever expect anything to go back to how it was because it won't. And to
Nothing
think
ever
that
does.
you're going to get it back to that,
Right.
you're fooling yourself. It's never going to be how it was before. You can make the best of this,
Sure.
but what's gone is gone.
And that's true for life, but especially in that situation. By the way, another T-shirt, 100%. Survivorship anxiety, QR code. What's survivorship anxiety?
Yeah. 100%.
Survivorship anxiety, hashtag cancer culture. Well, something cancer related, QR code. You're educating, and it's cool.
Yeah.
Like, I would be like, honey, I'm going to QR code that.
Because cancer's not over when
Right.
treatment ends.
Yeah. No, you're.
That's
well,
a
and
good shirt too.
And that's the thing is you're never.
No, really, like you're never over. Like Felix asked today. I was telling Felix, "Hey, Sonny's coming to do a podcast," and I said, "Hey, Sonny got really sick. He got this thing called cancer, and then he beat it, but some people don't." And he's like, "Is he still sick?" And I said, "We're gonna find out, but I think that he has to kind of monitor,
Right.
and also mentally, right." Physical and mental repercussions. That's what people don't realize, the mental side.
I think the mental side could ultimately be bigger than even as horrible as chemo and all that stuff is, and the side effects and the health problems and everything. I think the mental side is probably bigger than all of that.
What is it about the chemo that made it so horrible? Like, and maybe go back to painting that scene that we kind of, I sidetracked us a little bit. Is it just literally having to endure that much pain for that long and getting, and how do I even, I remember you telling me this. I've told, by the way, other people this story to help them deal with whatever they're going through in terms of how you used to chop things up into the tiniest goals. And I thought that's so interesting. Talk about eating an elephant one bite at a time, but this is like,
That's what
it's
it
so
was.
painful. You got to go to like, I remember you
Yeah.
were saying like 5 seconds,
That's what
just
it is.
survive
You
for
watch
3
the
seconds.
clock. Yeah, your goal is to just make it through increments on the clock, and
Yeah.
it's it's an extreme amount of pain to the point where there would be times where my mom comes up to just like caress me, and that was painful.
And were you like, don't touch me?
Yeah, at some point I'd just have to tell her, look,
Yeah.
I don't want you to take this the wrong way, but please, like, I just can't be
Yeah.
touched right
Is
now.
is it similar to a woman delivering and they go, don't touch me? You did this to me, you son of a bitch. Is that?
I can't speak on that.
Sorry,
but
sorry to inject humor.
I'll tell
into-
you after the transition. I'll tell you.
Sorry about it's injecting the humor in the wrong spot.
But, yeah, you can understand.
Yeah, it's,
Yeah.
So much pain.
It's so much pain. And I can't relate to that because most people can't relate to that.
and that's again, I don't know if
Nader
everybody's
level.
treatment side effects and everything feels the same, but
Yeah.
I mean, for me, it was a lot of bone pain, a ton of bone pain. So
Yeah.
my skull, you just felt like a constant swelling of your skull, like everything was just getting squeezed. And
Can you explain it to layman's? Like, can you relate it to things we suffer with, like having a headache, migraines, sore muscles?
I mean, nothing could even really compare, but I guess if you have the absolute worst alcohol poisoning that you can think of, like how incapacitated you are during that would be, I guess, kind of scraping the surface of,
Yeah.
of that part of it. But there's so many dynamics to it because there's that pain, there's digestional pain. I mean, you're dealing with the worst stomach issues that you've ever felt.
Like and nausea.
Nausea, not being able to control your your stomach, your bowels, you're constantly having to take medications that are like a lot of people don't think about it, but eye drops that I had to take were to prevent your eyes from hardening from the chemo, and you start to taste those eye drops, and that's one of the worst flavors. If I tasted that right now, I'd probably vomit.
You tasted through your eyeballs?
Yeah, so the tear ducts, I think it gets down into because it goes like you can taste it in your throat. And
Oh my God.
And that's just one aspect of it, because what happens during chemo is you lose your taste buds. Nothing tastes the same anymore. So for a limited amount of time, but well, it could be a significant amount of time. So drinking water, for instance, tastes metallic, has a metal flavor to it. And so you can imagine if something as simple as water tastes like metal, everything's going to change flavor-wise, whether it's whatever food you have to eat, it all changes. And everything tastes terrible, but you still need to ingest to keep, nutrition, everything. And that's another thing that I do recommend to everybody that's going through it is, as horrible as it is, you still focus on trying to not eat all the sugar that the hospital offers you, because you can have anything you want at these hospitals. They will give it to you, because as long as you're ingesting, they're going to be happy. And that fulfills them checking that box. But for you personally, I would, as much as you can avoid it. Obviously, we're human. We're going to, from time to time, you're going to have stuff. But, I mean, high protein, limit your carbs. Don't cave into every opportunity for ice cream and all these things to be brought in from the outside, because they will give you anything. They know you're in a low place, and they're going to try to appease that. Same with your supporters and your caretaker and everything.
Here's a double-double. Well, double-double might be okay.
Actually, that's
Yeah.
that's not terrible. But
But
it's
the
mainly
candy
just
and
pure
the
sugar is just not
Cokes
going to
and-
help you.
yeah.
And I mean, there's going to be points in time where you get to where all you can put down is like an Orgain shake or something just nutritionally to keep you going. But most of the time, you're going to end up in a place where you don't want to eat anything.
Yeah.
And you don't want to walk, and you don't want to move, and you don't want to breathe, and it gets. And that's the other thing. So you're asking about how bad it is feeling wise, but you could be feeling that bad, and they could come around and say, "Hey, it's time for you to go walk the halls. You got to walk. You got to take laps."
Why do you need to walk?
So your lungs, if you're sedentary for too long, your lungs won't keep operating at full capacity because they'll start to weaken, and so at worst, you have to use the spirometer to still do breathing exercises, but also just for physical ability. You want to
Right.
keep up some strength.
Exactly.
But it doesn't matter how bad you're feeling.
Right.
When it's time to walk,
You gotta do
it's
it.
like you can only push it out for so long before you got to start doing some laps.
Right.
And it's not like laps walking. You're constantly hooked up to a pole. You're walking with the pole. You're walking with your parents. It's like very slow. Very
Interesting.
it's like an arduous journey
Right.
each time you have to get up and do it. And that's, and then they say, oh, well, rest is so important. Well, I mean, you got people coming in to take your blood at 5 a.m, 4 a.m. You got to stand up for the scale. You got to, you got to eat breakfast. You got to take your pills on the time that they give it to you. Like they're doing your blood pressure every hour. You're constantly being interrupted.
It's nonstop, man.
And to try
No
to get
rest.
a rest, it's practically impossible.
Another metaphor analogy came to mind that I would like to propose, just because for like me, like I'm like, oh my god, and it's related to the military PTSD thing. I thought you're basically voluntarily enrolling in torture.
Yep.
It's like people that get caught by some other country and they get tortured, beaten to where they're bruised everywhere, they can't breathe, they're malnutritioned, they're not given water, they're nauseous, they're getting sick, and it's kind of like that.
But
like
you're
I'm trying to,
voluntarily
yeah,
checking
but
in
you're
for it.
volunteering. I mean, because you got to kill this cancer,
Well,
so
and
you're
that's one of
basically
the craziest parts.
you're
is-
torturing the cancer as if you're a freaking, and then you're along for the ride, and you're hoping you can outlive this fucking cancer.
Every time we took him in for treatment, I was wishing that we were taking him to jail for the year,
Right.
not for treatment.
Yeah.
Yeah.
Prison would have been way better than.
Right.
Yeah. Well, and the craziest part is you're told you have
Even a
this thing.
torture chamber where they're beating you every day, but you still like don't have to go through all this would be better.
Right. Just the physical part.
yeah, just
Right.
if they're tell us what you know, and you're like no, and they're just like, pow.
And that's one of the strangest parts is you're told you have this thing that you don't see.
Yeah.
At least with a tumor, it's like I see a tumor.
Oh shit! Did you ever think like,
if I didn't
what
have
if
any-
I don't have it and they're just trying to make money off of me?
That goes through your mind multiple times. There's some things that are saving graces where I know, okay, well that wouldn't have happened if I didn't have it.
Yeah.
But for the most part, you're being like preemptively treated for this thing that hasn't really shown me that it is this thing.
Was
And
there a
so-
point where you're like, oh, that's 100% now? Like you
Yeah,
did
when I
multiple
relapsed,
tests
it
and
was,
okay.
Yeah. So I mean, and that's the thing. So we did those 4 rounds, and the other thing that nobody ever really thinks about is that it's not the chemo that's going to really mess you up all the time. Every single round, you're going to get an infection because your body has no immunity. You can't fight anything. And I'm talking about my mom cleaned the house like nobody cleans a house, and we tried to keep everything clean. Chief, I didn't get a pet Chief for a year. Chief's
Wow,
my
dude.
long-haired Chihuahua.
Right,
For those
right,
that don't
Chief.
know.
Who the
And-
hell is Chief?
Yeah. Didn't get
Why
a
are
pet
you
Chief.
petting him? Chief. Oh, jeez.
So yeah, and
Yeah,
so
dude.
and
Got a
and
pet
even with all those precautions,
Yep.
I still got an infection almost every single time. And these infections are not like these small time things. I'm talking about rigors to where your leg, like my mom was holding my legs down, I couldn't stop shaking. You get spikes in your temperature. I mean, it's endless. You can get all kinds of things from these infections, and then you can end up doing a clinical trial for an infection, like I did. I had to do a clinical trial for an infection that I got in the line that's going into me. so that they had to put medicine through that, which you also taste, by the way, and it's all horrible.
Even when it goes through your...
Yeah. So
How
when
did the hell
they
you
give
taste?
you, that's a great question. That I have to actually look into, because when they push the solution before they give you the whatever the medication is, you can taste that solution. It's like in the back of your tongue. I don't know how it happens, but it's very plasticky flavored, I'd say. So yeah, you're dealing with, you do the 2 weeks on, then you're going to the hospital every day, but then you're also probably going to get an infection, so you're going to probably go back to the hospital before your next round, and you're doing that for, a significant period of time. You get through all of it, and they told me that the cancer's gone, and they said that, and I saw you right after
when
they
we
said
came
that
to
it was
visit
gone
you.
in Long Beach.
Yeah.
And so,
Our families go way back, by the way. We kind of
Yes.
jumped in.
That's
My dad, your grandfather were extremely close
Your dad
friends
played a
from
huge role in my
Kiev
dad making it to America.
Yeah, Kiev, Ukraine to America, and then
That's
we were
right.
all family friends here, and then your dad and my brother are best friends to this day,
That's right.
childhood friends.
We're all
and then
family
you and I
now.
are great, becoming great friends. I
That's
would
right.
say, we're just family, man.
That's
so
true.
that just to say, because we didn't really give any
Introduce-
context here of what the
Right.
hell, what are you doing with me?
Right. Yeah. So,
But
I totally lost where.
yeah,
I
no,
was.
it's okay. I was gonna ask you. You said then that's when you saw us, when you were done with your chemo,
Oh,
and
right.
you were in the hospital
Right,
still
so
recovering.
We came out and did a celebration lap in Long Beach with the family
Yeah.
and with you guys, and we thought that that might be it. And prior to that, I had already talked to my mom about having like imposter syndrome, just kind of feeling like as much as I did just go through all of this, I still feel like I didn't get a transplant, so like I just didn't feel like I really beat it in
Yeah.
a way, which I mean,
Wow.
ultimately I didn't.
You felt like you cheated the process, like I didn't do the whole thing, like
yeah,
that.
exactly. I didn't do it all the way.
I just did half-assed it. I just half-assed it.
Right.
Wait, how long? This was 2 weeks on, 2 weeks off for how long?
6 months.
Jesus.
I think total.
6 months.
If you take from when I started in Vegas to my end, it was like about 6 months.
Wow.
And then so of course you go through the celebratory phase of everybody, thinking everything's going to be back to normal.
Yeah.
And then before we even finished that trip, I got sick, and we go back, get a blood test.
How long was it? It
and
was like a 1 month kind of lap?
I think if a month, but yeah, like around
like
a
a couple
month.
weeks, and you were
Yeah,
sick again.
And then I was
Sick again, like relapse?
Yeah.
They
Well, we
tested
didn't know
you?
at the time, but we went back, and yeah, so
And they tested you, and it was a
yeah,
relapse.
it was coming back. So, and at that point, we had already known there was no option outside of transplant. Luckily, we had preemptively tested my sister to see if she was a match, and yeah, fortunately enough, Nadia, my sister, was 100% match, which is like the odds of that were already very slim.
Oh, really?
I want to say it was
I would
like
think if it's your
30%.
sister,
That's their first 25% chance.
25% chance.
Yeah, and so that ended up going, miraculously.
And if
our
she
way.
wasn't a match, you'd be on
She
a waiting
wasn't-
list.
So yeah, we would be looking for unrelated matches, and so they always go related donor first, unrelated if
Sure.
nobody matches. Actually, the first would be using your own blood back through, and if you can, I couldn't do it,
I
but
see.
if for lower, I guess not as high risk people, they can basically use your own blood to do like a transfusion, put it back into you, and then you have
Right.
a chance at resetting.
But
I
yours
didn't
wasn't.
get that. So then, yeah, Nadia got her.
Would you have been able to get another transplant, or it's like, oh, you'll never get a donor, or is it pretty easy to find a donor?
It's not easy to find a donor. There's a good situation with Ashkenazi Jews. There was a guy that started a donor bank for them like a while back. So they've kind of built up more of a bank than a lot of other cultures or ethnicities, I should say. And luckily, I never had to deal with it. I don't, you
Right.
know, and I can't even imagine how bad it is for people that either can't find a donor or end up putting themselves in a position where they say, you know what, a 70% donor is all I can do. Because when you do that, then you're running into it's called GVHD, graft versus host disease, and that's basically the new body, the cells that they're putting in are finding them as an enemy, attacking their body, and that can range anywhere from skin issues all the way to organ failure and death. And so it's like you're taking on a whole nother challenge.
Right.
I had GVHD at a very low level, and that was bad enough for me. Now I have imposter syndrome that I didn't have the. No,
Right.
I'm just kidding.
No,
Right.
that's the thing. It can
But talk about that, yeah.
happen.
Yeah, and
Yeah.
it can always anything could trigger it. I could use a face cream or like a body wash that's not agreeing with
Can
me.
trigger what? A
It
relapse?
could,
or
a relapse can also happen, but that was just with the graft versus host disease.
Yeah,
the
yeah.
skin could just react poorly to something. It could
Before.
happen anywhere.
Or even now.
It could still happen.
even though you
technically.
got the
Yeah.
transfusion or no?
Yeah, even so, and relapse could like leukemia is technically never cured. So it's like if you make it to 5 years, it's considered survivor.
Yeah.
I'm almost at 5 years, but I could relapse at any point in time.
And if you do, what needs to happen?
It would be an immediate look for another donor.
Got it.
There's no other option at this point.
Your
So
sister
it's-
could be a donor or no?
No, I don't think they can run her twice. I think it would have to be something else.
No way. So you got to get another donor.
Yeah. And
So
I,
did you already get a donor?
I feel like I had unrelated matches, right? I want to say I had some unrelated matches that were 100%.
And what does it mean? People that are alive somewhere that are willing to do a transfusion,
Yeah.
or it's just like there's
They-
some
they
bone
need to
marrow
get-
in a lab?
Well, there's people that donate. There's like a donor. Well, there's like the Jewish one I was telling you about,
Yeah.
but there's other
It's called Be the Match, although they just
be the
changed
match.
it.
Yeah.
And
But how-
We're probably gonna set up something in Vegas, a sign up. And
Okay.
basically you sign up to be a donor.
Yeah.
And if you're ever matched, they call you. You're not obligated.
Right.
Right.
Maybe something in your life you can at that
Right.
point, but you're signed up to do it.
So yeah.
if need be.
And
Okay.
then they harvest it from you if you've agreed upon.
What's the process like? Like if
believe
I was
it's
considering
it's a
it-
PICC line that runs through a machine that separates
Right.
the cells to what the cells that they need, because it's like stem cells. It's not like just
Right.
everyday cells. And once they separate it, it goes into a bag. And the process of transplant is very simple. It's basically just like a blood transfusion.
Oh.
You hook it up, it goes into you. You watch, a milky colored red substance, which is all the cells, go into your body. It's called day 0 when they introduce those cells into you. You're going to smell like creamed corn for the next, I don't know, how long was it? 5 days or
Yeah,
probably around 5 days.
creamed
which-
corn.
Yeah, which initially doesn't seem that bad, but when you're around it and everything, your body's just emitting this. And the reason for that is there's a preservative that's used for those cells that's
Yeah.
binded to it. So when they introduce it to your body, the gases from that have to come out.
Yeah.
And so it was actually before I even got it, you would walk the halls, and if you walked by a room that somebody had it, you smell the smell. I'm actually getting nauseous. just
So
thinking about
so t-shirt, get used to creamed corn.
Right.
Start liking creamed corn or something like that.
Just to let you know, as far
Yeah.
as donors go, before they do give their cells, they do have to get these shots that kind of help produce
Yeah.
more
Oh, that's
stem
right.
cells.
Yeah.
I forgot about that part.
And then they draw your blood, or they draw something else.
It's your stem cells, maybe your blood with it, but I think it pulls it out.
Yeah, the
Like from
machine
your-
that
where
it's
do they
going
pull it?
into is what's separating. I
transplant.
think the.
Well, because it sounds scary. So I'm just wondering.
It's a relatively harmless.
Harmless.
Yeah,
Okay.
Like
And the shots are
procedures-
harmless and
It's the lead up to what he had to go through in order to have the transplant.
right.
Right.
That's probably the
Yeah.
most-
But
Yeah.
I'm just thinking. I'm thinking from a
From a
potential
donor
donor's
perspective,
perspective. What do they need to know to decide yes or no? Because there's
think-
probably people that are probably willing to do it if they
For
knew
sure.
about it, but probably don't really know what it is. Or if they heard about it, they'd be like, "Oh, that sounds like super invasive." Like I thought, "Oh my God, what do they do? They go
Right,
into
how
her
do they get the
bone?
marrow out?
Do they go into her bone? Damn!
Right.
Forget that."
Yeah.
You do have to take shots.
Yeah.
And then you go in and get it taken.
What kind of shots though?
It's like to increase your cell counts, basically.
So it's not
like
nothing bad.
No.
Okay.
And it's like I'm sure there's some minimal side effects.
You're not
but
gonna grow
nothing-
like an extra boobie or something.
No.
Okay.
And I think like Nadia went back to work very soon after.
Oh, okay.
If not the next.
But
day.
you are out like for the day,
I
or
think yeah, I'd say the
maybe
day.
a day or
yeah.
Yeah.
And
a-
it's
a
basically
short
it's just people that want to
It's
donate.
gonna be
There's no
timeline
like yeah
pretty much maybe to where the person's having their transplant.
yeah
Right.
That might be something you're gonna have to do.
got it.
Right.
What's the best pitch for someone to go do this? Like, hey, help somebody out, or is it,
could
hey,
say
if you know somebody in your life that went through this, you know, if you donate, like you are saving a life. What's
Coming
the-
from experiencing it and needing it, it's literally saving a life.
Yeah.
That's what you're doing.
Yeah,
And
like-
if I mean, I don't know what else could be more not lucrative, but
fulfilling.
yeah, fulfilling and
Well, I was gonna say, here's a great pitch. Does your life suck? Save somebody's life.
Right.
Like instant boost.
Yeah.
Life sucking lately? Donate marrow and save a life. No, really,
Yeah.
like that's kind of like people need that shit. Dude.
Yeah.
A lot of people feel in
Yeah,
a bad
it's-
place.
it's,
So imagine saving somebody's life by doing something relatively simple, but most people probably would be too scared to do, which makes you even more of a hero that you went and did this.
Right.
Now do the right thing. I'm just like, imagine. It's a good promo right
Yeah,
there, dude. From the heart.
The donor side of it is very.
I would do it. Like
cut
if,
and
if
dry.
someone needed it, I would do
Oh,
it, of
yeah,
course.
for sure.
Especially a family member, but even like a friend that was like, dude, you're 100% match. Oh shit. Fine.
Yeah.
Right? Even if like a person I knew came to me, I'd be like, God damn it, fine.
I would say it's much
Like-
less invasive than any kind of kidney donor.
Yeah,
You
yeah,
know,
yeah.
It's like it's way easier. than
Right.
any of that.
Well, good.
Right,
Good
yeah,
pitch.
yeah.
It's way better than kidney donation.
Right. It's not your organ isn't.
I wouldn't
being-
go with that pitch, Sonny. I'm just
Just saying, it's way less of. A
They're not
process.
removing an organ.
Way
Right.
less invasive.
Yeah.
Hey, is it bone marrow donation? What is it called?
It's a
Stem cell, yeah.
It's you're donating your stem cells because bone marrow. That's what's
It's
in
produced in.
Now that sounds a little scary,
It does.
but you're doing it to help a cancer patient.
Right. Well, and there's communities that could really use much more donating than they've had. you
Yeah.
know? Like I'm pretty sure minority communities have a really low match rate. You know.
Ah, so
And-
people sitting there going, I can't.
Yeah, and it's like you could really help out just by a lot of people starting to do the be the match thing. You could build up a bank of people that could possibly save lives.
Right.
And yeah, I think there's tons of room for of all kinds. All kinds of people could.
You know, just another little side idea, because I'm thinking like from the donor's perspective, if this is something you guys want to help like promote, is you can also raise money from donors, like money donors, that are willing to pay people to donate, to donate. Like, hey, we're starting a new thing. Like, we have this donor that's willing to, give somebody that's in need, let's say, $1,000 for donating their, doing this donation.
Yeah, possible.
Like, just to, do it from another angle, so you're not just waiting for people to just do it out of the kindness of their heart.
Right.
But you need somebody to fund that. Just a thought.
Well, that's kind of we're probably going to do a donation.
Yeah.
Donation thing. And
Yeah.
Have it set up somewhere with high traffic, so people come in, we'll give them something.
Right.
They're going to sign it.
Like a cool gear, like, dude,
Yes.
donor, or I'm a donor.
Yeah.
Right.
Like,
it's,
I saved somebody. I saved a person. Like, wow. Or say it in a less show-offy way,
Yeah, I
but
was gonna say.
I'm a donor.
That's
I'm
until you get called as a match.
yeah, and then wow, that's cool. Like, it's not that big of a deal to get like a sweatshirt or something, but still, like, to like you kind of like honor them and kind of give them some kind of
Something in return.
Yeah. prize to do it.
Just like blood donors are in need.
Yeah.
This is like even
Exactly.
for what he had. Blood donors were
Yeah.
needed.
Right.
He had to have blood almost daily.
Yeah, and until you're in that situation, you don't realize, you don't think about it. You don't want to think about it.
You don't think about the actual act of doing it, and you don't think about the insurance that needs to approve you doing it.
Right.
Because that's an entirely other issue that you have to deal with, which again goes back to having a caretaker that's doing all the paperwork and doing all that is
Fighting.
you need it to survive. Because there's times my mom's arguing with the insurance companies and getting things sent to the doctor and back to the insurance company just to approve me getting like a bag of platelets, and it's like, I know I need it to survive. Insurance could care less because you're just a number. So it's
Right.
It's a battle. That's what it is. And having somebody that can handle all of that while you're doing it it's utmost important.
Yeah.
It's everything. And yeah, so it's the donor process is simple. It's the person going through that needs the transplant is going to have their roughest bout of chemo to get you to the point where you can accept transplant. That's where you're going to get I'm trying to remember the name of it. The name of when you're starting to get ready for transplant. Consolidation, induction.
And
Oh.
then you do another induction.
Man, there's so many names. Basically, you're going to get hit with enough to get everything down to zero so that they can introduce the donor's cells.
So when you went back and you relapsed,
Mm-hmm.
right? How did they know now you need a transplant?
Because we've exhausted all the
Got
other
it.
options.
You tried the other option.
We tried doing the full thing of chemo, and it didn't work. So,
Right.
and your body. That's the other thing, is your body can only take so many rounds of this. So you
Right.
start judging, like, all right, is it worth trying? Because we had a debate of whether, should I do another round of consolidation prior to doing transplant? But it's like, how much can your body handle?
Exactly.
And is it worth what
Right.
you're gonna do?
It's like your check engine light's on, you reset it hoping the problem went away.
Yeah.
You're like, yeah,
Yeah.
like we might as well just go get this diagnosed and
Yeah.
do it right.
And you want to be strong enough to handle the chemo that it takes to get into the part where you can get the
I
transplant.
see. So now you got to get hit with chemo even harder. I'm taking it.
Yeah, it's
Because you want your blood count to be as low as possible to introduce the new blood.
correct, yeah.
And then how do you get rid of the old blood completely after that?
That's what the chemo does. I mean, the chemo is literally
Literally,
killing.
how do you get to
all of
zero though? Aren't you like
it.
on life support at
you're-
that point?
You're
Constantly is getting transferred.
yeah.
Oh,
Alive until the transplant
You're getting
happens.
transfusions of
Yeah.
blood and platelets to keep you going.
I'm just okay. I'm just probably too dumb to understand it or ignorant. But
get
like
it.
yeah, like I'm just imagining like okay, you have a new set of blood coming in, and then they got to get rid of your old blood. So I'm just how do they?
And they're constantly doing that while the chemo is killing all of it. So it's just this constant rotation of what they hope is healthier blood.
I see. So so meaning they never really got rid of your blood 100% because they had to keep a little bit in there, get the new blood
And
in.
that's why I have two kinds of DNA. So my peripheral blood is my DNA. My marrow blood is my sister's. Yeah, it's called chimerism. I'm technically a chimera because I have two different
Camaro?
chimera.
Chimera.
Yeah, which is
Yeah, I
like,
like
a
that
Greek
one.
mythology creature of like a lion, a goat, and a dragon mixed together.
Dude, t-shirts. Come on. This is a podcast on t-shirt. You gotta design that.
Yeah,
Chimera.
that'll happen for
Chimera hashtag cancel culture. QR
Yeah.
code. What's a chimera?
sure.
Dude, so you're like part sister.
Yep. Yeah,
Right?
That's what I.
Does it affect you? Do you notice like you have cravings for certain foods?
Not really. I would say, if anything, I had eczema before cancer. Now I don't have eczema anymore.
Do you suddenly know like doctor procedures?
Yeah.
And then, like,
I've had a certain interest of medical knowledge. No, trying to think what else. My
Get
hair
outta
color,
here.
I don't. Yeah, I mean, they say that's part of it, that it
What?
could happen, but I don't know. If
I am like learning things. Was I just born? What I'm learning stuff that I never knew.
This is the only reason we learned it was because of the situation. It was all news to us too. So, yeah, you could end up with like curly hair if you had straight hair. Like a lot of things can happen. And yeah, I mean, luckily I didn't want a lot of change. The most change I had, the hair on my head doesn't grow back the same, but my facial hair grows way more. So that happened. That's pretty much it. I haven't really had any other major changes. My eyes didn't turn blue.
I mean, this is definitely the
Hoping for that.
beginning of a movie plot where things go a little south.
right? Yeah.
Right? All of a sudden, I have these thoughts, and then you go, Nadine, are you?
Are you me?
Are you?
But yeah, it's,
Dude.
so then
That's
I
so interesting.
got the chemo to get to that point.
Do you feel more
and-
connected to her? Last question.
More connected to her.
Through the transfusion?
I'm just forever grateful,
Yeah.
but I wouldn't say more.
Like
connected.
twins, like, oh my God, I
You
was
know, we're
just
not
thinking of
reading
you.
each other's minds
All
or
right.
anything, but but she her son's middle name is my name, so there's that deep connection, and I mean, what she did for me is, I wouldn't be here if it wasn't for her. So I'm forever grateful, and she means the world to me, and she knows that, and I mean the world to her. So
Love it.
yeah, and I mean, good thing me and Nadia were already on good terms before that. It wasn't
Right.
like I guess I have to give you my blood, but
Right.
it was a positive. So she wanted to help any way she could. She was already visiting all the time, because she was already in Houston, so we were basically living in the same apartment complex as her and Adam, her husband. And yeah, I mean, she was always checking in on me, and then she got to help with the ultimate way, which was the transplant
Right.
donor. So it was it just, a lot of things had to go right in a really bad situation for it to all work out.
Yeah.
And it did. And I'm grateful for it. And now I get to create this thing that can hopefully impact so many other people's lives and improve.
Yeah.
them.
It's a great movie plot too, like how it all
It
worked
feels
out.
like it, for sure.
So then, okay, and I also still want to go way back, but we'll do it like Pulp Fiction. So then,
Right.
so then,
Quentin
yeah,
Tarantino it.
we'll go back and forth.
Right.
But like, okay, so now you go through the blood transfusion.
Mhm.
Tell me what happens after that, and how does that get in? How do you eventually start like Infinite Motive, and how did that all kind of?
Okay. Well, so first I'd say I want to say like 2 days after transplant, my mom and I talked to each other, and I was like, "This is going pretty smooth. Like, I'm surprised it's not worse than this." And then pretty much right after that, I think things really started to take a turn. I had this evening where I had left the restroom, and suddenly my PICC line wouldn't stop bleeding. I just started having blood come. I think I hit it or something with my arm, or like a lot of times it can get snagged on something, and so it started bleeding. And the IV team comes in, and for whatever reason, they keep sending the wrong IV person, so it's bleeding, and they're trying to hold it and keep it from. And then I get really nauseous, and I start needing to vomit. What happens there, sorry, it's going to get a little graphic, but since your body's completely killed off anything inside of you, you don't have the proper digestive parts to like create waste how you typically would. So essentially the food I had not digested at all, and now you're trying to get that out of your throat because you're vomiting. So it's not coming out the way people throw up. It's basically slowly working it up with your muscles to get all this like solid food out of your throat. And my mom's holding the bowl while they're holding the thing while I'm bleeding. And that kind of kicked off the worst parts of the post-transplant survivorship.
And that's just part of you having to
that-
go through all of the chemo and the transfusion at the same time.
Yeah.
How long is all this taking, the transfusion? This is
The
just
transfusion
one day?
took maybe 30 minutes.
Okay.
I don't know. Like maybe an hour. It's just one bag.
I see.
It's everything after that.
Yeah, it's after
the
that.
effects from the methylene and the cytarabine and all these different chemo.
The medicines.
Yeah, and so yeah, there's days after that like, you know, I'm in and out with my consciousness wise and knowing what's going on, and they get worried because I can't remember what they asked me, but I didn't know my birthday or something. Is that what it was? Yeah, I was just not answering things properly, so they were getting worried about
Right.
that. But ultimately what happens is the most important part is the first 100 days. So in that 100 days, you're like constantly getting checked up on, and you're on immunity blockers. I'm trying to remember the name of it, but I can't off the top of my head. But anyways, so there's a lot of side effects that you're just going to go through medications wise, recovery wise. But the most important part is just that first 100 days, just staying like no infections, just trying to stay healthy so you don't get, because you're so weak at that point that a small infection can really take you out. Ironically enough, COVID was starting to, start at that time. I finally get to my 100th day, and we make a day out of it. We're gonna like go to the movies, still have to like cover up and be like super safe, but we go out, we see a movie, we come back, and the next day the entire country goes on lockdown. So now you're talking about anxiety of the social side of things. You went from, at least when you went out in public, you're masked up, people know something's wrong with that guy. Now everybody's in masks, everybody's just treating everybody the same way. You're not getting any kind of special treatment. Nobody cares really. And so that part got challenging, just from like you already feel so detached from everybody, and now they can't even spot you
Right.
different from everybody
So you're
else,
even
'cause
more
you're-
misunderstood
right
now.
And so, and I mean, as far as where Infinite Motive came about, it was discussed leading up to, I want to say probably during consolidation, we were already starting to like brainstorm on it. The idea was we had already seen the clothing that's available in cancer centers, and it's all the same stuff. It's all ribbons, it's all the same wording, it's always cancer in your face. And we were just like, why is there nothing that just kind of looks cool enough to just wear normally? And I felt it for me, I felt it for caretakers, supporters. It's like, it's just so cheesy, and I hate to like rag on it because it's for a good cause, obviously, but it's the same thing.
Well, there's
over and over again.
a missing piece in the market that's
Right.
not being served.
100%.
They serve a purpose. It's simple. It's easy. You put a wristband on, but why not have a brand, an
There's a
actual
whole
brand?
thing missing that
Yeah.
could really. I truly believe it would be the household name of, if you think of cancer clothing, you think Infinite Motive.
Right. And the fact that a lot of people are basically going to be patients for the rest of their lives. Like, in a way, it could always, something for some survivors, it could relapse. So even if you survive, you're always part of the culture in a way.
Always.
You know what I mean?
And, we talk about it being the club that nobody wants to be a part of, but
Right.
we're all in that club.
Exactly.
And that's, what I notice with a lot of people is they don't show interest until they've been affected by it or know somebody affected by it, which is fair.
Yep.
I would probably be the same way if I never got it. I'm sure I would always keep it at an arm's distance because you don't really know much about it. Cancer is a scary word,
It's
but
scary.
you don't know really
Right.
anything more than that.
People like
And
happy endings. People get uncomfortable with real life, scary, challenging things.
Yeah.
But you're also bridging that with your brand because you're like, okay, let's make it approachable for
Exactly.
everybody so that more people can, not everyone's going to, embrace it, but more people can.
Right.
And it's more inclusive. So it
And
creates
that's
more
what
support,
you'll see on
more
the-
support, more cohesion in the community with your support team. It's like everyone's wearing a uniform in a way, a cool uniform.
Yep. And then ultimately, we're gonna make a combination of. It's not just gonna be that support. I do plan on going on. My face will be more prevalent in the social media side of things. I will have lives in which I am willing to discuss any kind of survivorship, any kind of treatment. I want to kind of tiptoe around just because treatment's different for so many people, and I don't want to be like, oh well, that guy said this is what I should be doing. Like, no, I'll tell you what I did and what worked for me, but that's not necessarily going to work for everyone. But mainly just as I know that when I got diagnosed and when I was in the bed every day, if I knew that somebody was going on live and talking about things or answering questions or giving you some kind of feeling of normalcy when you know that you're just left out in the world, like the world keeps going and you're just in this bubble of, dealing with your stuff. So yeah, if I could provide that kind of platform of people to have.
You got you have a TikTok already?
I do, yeah. I'm not as active on it as Instagram, but yeah, I do have.
Let's
TikTok.
let's do a live.
Okay.
I'll moderate for you.
Sure.
Like I'll have dumb questions as because I'm representing
Just
the
to keep
idiots.
it going.
I like this is my own personal thing. It's not like a bad thing. Like
Right.
I like that because I can ask dumb questions and learn about something because I'm not an expert.
Right.
Obviously, if you haven't been through it, you can't be an expert. There's just
Right.
too many terms, even for you to remember everything. Right.
Exactly.
So let's do it if you
I'm
want.
down, yeah.
I'm happy to moderate. It'll be fun.
Definitely, yeah.
And I'm not afraid of the subject. And then I feel like people calling in asking you questions, or they're asking you questions, and then you're talking to me, so it makes it easier because I've been wanting to do like coaching lives, like just put myself out there. Yeah, I want to help people, so let's go live. What's your problem? What's going on with your life?
Right.
But it's scary.
Yeah.
So it really just hit me now. I'm like, dude, like if I had a moderator, much easier. Maybe you
sure.
could be a moderator for me, but I'm down to do it for you.
Yeah.
To just get it started. Then later, you may not need a moderator, and I'm fine, but you should do it as soon as possible because I feel like yours is even more important than mine because you have a very clear problem that people are suffering through right now, whereas mine is more like, I'm sure I should do it too. No excuses, but there's people that might need my coaching, right? That are going through hard things.
Yeah.
But you have a direct, you have somebody out there that needs to hear you right now. You may only have 3 people watching your live. I've had lives before when I was doing them where there'd be like 3-4 people consistently, people coming in and out, but 1 or 2 people stayed on the whole time. And after they messaged me and they were like, oh my God, like that was so like uplifting and I learned something. Yeah. So it's not about,
100%.
and you got to start somewhere.
100%.
And I feel like TikTok Live is a great platform. Yeah.
Yeah.
IG is not a good live platform.
I feel like TikTok will feed you people that you don't
Yes.
know way better than Instagram.
Yeah, IG, the lives are just usually, I think it's just your people.
Just your
right?
followers,
And so
right.
that's great. Keep in touch with them, answer questions. But TikTok, you can build
Random following.
you can build your following a lot better. And
Yeah.
I think you should do that right away. Like next week,
Yeah.
just tell me when, and we'll just do
Start
one
one.
and then see how it goes. Maybe
think
you'll go,
that's
oh,
right.
that was terrible.
Because on
Or maybe it'll be
Instagram,
great.
I don't know, TikTok, Instagram, there's nobody
Right.
For cancer patients.
Yeah.
They'll have their, there's cancer
Yeah.
patient platforms.
Right.
Nobody's going live.
Yeah.
And why not?
I
And
haven't
do
seen
it on,
anybody
and then
do
do
it
it on
once.
both. Do it on TikTok. Do it on Instagram too. It's practice too.
I feel like once it catches on, everybody's gonna know. Oh, that's the guy that does these discussions. Like it's gonna catch on at some point.
And honestly, it's gonna be so natural and easy for you that you're gonna wonder why you didn't do it sooner. I know it's probably a little scary. Like, oh,
Yeah.
jeez, I'm gonna put myself imposter syndrome.
You're
by the
making
way,
a jump. That's what.
yeah.
it
Are
is.
you feeling imposter syndrome for that?
For sure. Yeah.
Why? Didn't you go through cancer treatment? Aren't you a survivor?
Yeah.
Didn't you go through a transfusion? We all have imposter syndrome. That's why I'm asking. Because what is it about if you're having imposter syndrome, what hope is there for the rest of us that always feel like, oh, they're gonna find out I'm an idiot? I don't know how to do my job because I'm just figuring it out as I go.
It's imposters. I start to get this feeling like once people know the story, they're gonna be like, all right, like we know what you did. Like we heard your story.
I do
like,
the same. You're afraid to inconvenience people. You're afraid of for people to judge you and,
be like, oh, it's
and go,
repetitive,
oh,
it's-
this guy, oh, poor me, cancer survivor. That I have the same problem where I go, I shouldn't post me dancing here because I can already picture, ooh, look at this idiot, look at him, 50 years old dancing, and then I go, you know what? Illogical, fuck that, do it anyway. That's why I'm posting half the shit I post because I'm like,
Doesn't
mental
matter,
fucking mental block, limiting belief, dude. It's a limiting belief. And if it's stopping you, you got to address it. So you got to just do
for
it.
me, it's at the point taking the leap of
Leap of faith.
Put your face on there. You're
So
gonna
let
be
me
a
help
video
you. I'm good at making people jump out of the plane. Not in a forceful way, but in a logical, like, okay, why are we not jumping? Now I'm going to moderate for you, which I'm like, oh, I could be a good moderator for people. I love selling people that I believe in. It's so much fun. Then it's better than selling yourself. It's hard to go, well, I'm a this and that and that. It's easy to go, dude, this motherfucker went through. You're not going to want to say that. See, I can go, Sonny,
hype
blah,
me
blah, blah,
up.
blah. And I do it naturally. It's not a fake thing.
Right.
That's why I don't want to work with people I'm not naturally hyped about. But if I'm hyped about them, I will be like their best. Like I go with my buddy who's a real estate agent, and he's very modest and he's awesome, but it's a problem. Yeah. We went to his neighbor's house to look at the construction, and I'm like, this guy's was in lending for 17 years commercial. And he goes, yeah, he's a real estate agent. Oh, Eugene, you do real estate? He goes, yeah. And then he recommended the guy that's doing his house. I'm like, dude, you're not selling yourself. And I'm like,
he's not his
this
own
guy's
advocate.
also an MBA. Like, don't let the nice guy fool you. I'm telling the guy.
Right.
And he's like, oh. So after I'm like, see, Eugene, like, you need to let's go together. Right. You could sell me, I could sell you. Dude, it's so much easier to sell yourself with another person. Right. That's why the co-hosting is good, yeah. So let's do that, man. Moderator. So that's an easy solve. I like solving problems. Like, the worst ones are the mental blocks. Like you're already down this road. There's no reason not to do the lives. And honestly, I would tell myself the same thing. Rick, what about you? Talking all that shit to Sonny. What about you? Oh, let's do TikTok. For 9 months, I told Gleb, we'll do TikTok live. I should just do TikTok lives. Gleb, maybe put the Never did it. Why? I was just afraid.
It's always easier to say, we'll do it.
Yeah. Oh, just get the camera. We're not ready.
Right.
Dude, I don't need a camera. I need my phone. Right. And nobody can stop me.
The more simple it is, the better.
I can go live right fucking now. Yeah. Like this. So let's do it. I'll do it too.
I'm ready to
and I'll challenge myself to make sure we both jump out of the plane.
Is it easy to do from two separate places?
Yeah, it's better.
Oh, okay.
We can't be together on a live.
Oh, that makes sense. Yeah.
Okay. And actually, I'm promoting your live. We're co-promoting too.
Yeah.
So I'm happy, which I'm happy to do. Misunderstood. It could be under the Misunderstood podcast or whatever. Rick Duchovny, doesn't matter.
Right.
But the point is, let's jump in and do it because you need to do it.
I do need it.
It's going to help your business,
and
but also
help me eventually because I also have to put my face on the videos that I'm creating, like to tell the story.
Right.
I've done it in videos of like clips edited. But I need to like actually piece it out on my social media.
Yes, dude.
And like part 1, part 2, part 3,
It's time, baby. Yeah. It's time.
It's
so what I guess, can you tell me things that you took from this experience, lessons learned that you want to share with other people, and I guess how this experience like really changed you? Okay, then I'm going to ask you, just in case you want to kind of bake it all in, I also want to ask you, what do you want people to know about you that they may not know, that they may be misunderstanding about you, that you haven't already talked about? you know, having imposter syndrome, all that. But start with like, what did this experience really do for you as a person? The principles you gain, the mental toughness you gain from this, the approach to life that you gain from this.
I think for me, the number one thing is it provided me a perspective that I couldn't have ever had otherwise. So I'd never been faced with true an experience of close death of that magnitude of, and not to be like a car accident situation, but like, no, you're going to get to sit and think about this for the next few months while you wonder whether this is it or not. And I think being able to be put in that situation allowed for me to kind of organize everything that was just scattered in my brain. I was allowed to just kind of put it in a diagram or something, or like, you know, kind of like a,
Because you had time, or because of the awakening that happened? Oh my God, death! This could be.
well, I think mixture of both, because you do have a lot of time to just reflect on anything and everything, but there's still that open road to go, oh, well, you could be bitter and you could be upset that this got done to you, and you could hate everybody and be mean to everybody. And my whole goal was, this is already such a crap situation that if I could at least make this as easy of an experience for my parents as possible, and if I could, you know, make everybody better for this and improve it for everyone, then it could be a better experience. And I tried to not lose a sense of humor and still, you know, find the humor. The day to day, you could be in a really bad situation and still find a lot of humor in it. There was times I was sitting with, you know, 104-degree fever and shaking and everything, and I was still making my mom laugh in the waiting room. And it's just like,
How do you do that? How do you tap into that?
just prioritizing it. It's all where you're going to decide to put your focus.
Like you're
It's,
coaching somebody through this. They're going through what you're going through. What are you teaching them now that you've been through it? Like, hey, this is what you need to do. Break it down. Like,
I think
what are the specific things that?
I think almost all of your power with a situation comes with what you're going to concentrate on. So whatever you concentrate on, that's what you will get a lot of.
That's your reality.
That's it. And so if you're going to concentrate on how funny it is that we're here and how funny it is that I have to, like, you know, climb up on this table like an animal to piss in this jar, then, you know,
Wow.
there's still humor in the darkest of things. And or I could be like, I can't believe this is my life,
Right.
and let everything fall apart.
Wow.
And then
The true definition of sense of humor, right? Because it's not about just being funny when things are going well. A sense of humor means you can laugh at yourself, life, when the shit hits the fan,
Yeah.
and go, wow, look at this shitty ass room. How did this fucking happen? This is hilarious.
yeah,
Never thought I'd be in a room with this much shit.
exactly. Yeah.
Turn that fan off.
Yeah, and it's such a, I mean, you're going through such a surreal experience, and so much of it is going to become a blur when you get out the other end, that you're going to have these few things that you get to hang on to forever, and that's going to be feelings more than it is going to be a specific event that's in your mind. And I think that it taught me patience, a patience that I never had. I was so frantic trying to have life figured out, and, you know, checking boxes of what needs to be accomplished, and it gives you the reality check that really none of it is something you have to do. These are all things that we're just,
Right.
you know, oh, I should do this, I should create a life for myself, and, you know, but this is also temporary and fleeting and could disappear in a second. That I think that being patient and showing gratitude for what we do have, and, you know, and I'm human, it's not like I'm always perfectly doing
Sure.
all these things, and there's a lot of times where I reflect on how I was back then, and I'm like, damn, I really need to incorporate more of that. Just because things are better now, you know, doesn't mean I should lose sight of the patience that I had, or the, you know, there's a lot of things that you know, people return to baseline, and it's I still think that I changed drastically from who I was prior to cancer, and I strive to continue being that person that I was as that patient, because that was, in some sense, that was the best form of me.
Wow.
Mentally.
Wow.
And
You almost don't want to lose that.
no, you definitely don't.
Wow.
And I mean, what I am grateful for is it shows me that in the worst of times, I know who I am. And that's, I mean, that's probably the most important thing. But it's applying that day to day when things are going well, or, or the trivial things are so small they don't matter. But when you let them get to you and blow it up into something, it's like, I need that, reminder of like, dude, this is where you came from. Like, what is that compared to this? So it's and that's always going to be a battle for everybody that gets through even the hardest times, because we're human. That's it. So it's I'm just grateful,
Mama's worst and proudest moment.
Yeah.
Right?
It was amazing.
You did good. No, you guys did a great job
We
to
held each other up a lot.
make,
That's right.
to develop a person that can be that strong too, that won't crack under the worst of times. And now you know that. So you know that now he's ready for anything. You don't have to really worry about that. So that's pretty amazing, man. It's amazing the positives that can come out of the worst situation. I think that's such a important message, because everybody goes through dark times. It's part of the game.
That's it.
It's in the game. And anything in the game could happen to you.
That's right.
So be ready, and the only way to really be ready is not to avoid it or to not let things happen to you, because sometimes things are going to happen to you regardless of what you want, but to prepare yourself mentally as well as you can through sports, through training, through discipline, through looking at pain a different way, through having a more positive attitude. Nothing can prepare you for that.
That's right.
And if you do have to go through it, man, embrace all the positives that are there for you.
Go through it fully with nothing held back. Just experience it through and through, and know that at any moment you can change how you look at anything. And that's your choice.
Right.
And that's the thing. It's like, not everybody has to go through cancer to apply that.
Right.
You just take your roughest point
Exactly.
and know that you can look at that differently.
Yeah.
And that's a choice that everybody has. That's the one thing we all have. And I think was it Man's Search for Meaning? Where, I mean, he's in the Holocaust. And,
Yeah.
He's choosing love over the day-to-day torture of that life. And
Love,
everybody has
empathy,
that
gratitude, embracing the game, embracing whatever the game is throwing at you, instead of fighting the current, fighting the wave. No, why is this wave? Well, you either, fight it and get wiped out, or you try to ride that shit and,
That's right.
and get up and ride it again.
That's right.
And that's all you can really
I
do.
think that's what we're all doing.
Yeah, absolutely, man. Very inspiring. Sorry for being emotional, but it's a good.
Emotion's
I like getting emotional. It's not like, don't feel sorry for me.
Yeah.
I'm like, I kind of cry a lot at movies and stuff. So it's not like, oh my God, Rick, are you okay? Yeah. So
It's an emotional
yeah,
subject,
dude.
so
And
it's-
I'm like empathizing with the moments, in my own way, right? Without having experienced them. Now, I know we probably don't have a lot of time, but I'm down to keep going, by the way. But go back now to like your origin story, however that means for you. I like to hear the whole thing. What do you remember? What did you go? What are the experiences with this, I guess, context? What made you, including what you just told us, right? So you already went through that, the person you are today, can we say CEO, captain of the ship of Infinite Motiv that you are today? Like, what made you what are all the things that led up to this? That wasn't the only thing that made you. Your childhood, your memories, what drove you, what made you passionate about.
I'd say there's like two parts to that. I think one part is my upbringing is it's, I think, well balanced is the best term for it. I think I had my dad, who was more strict and hard-headed and aggressive, and then my mom was the polar opposite. She was like soft and nurturing and loving, and having that balance kind of gives you all the tools to deal with something as terrible as what I did, or any kind of challenges really. like if it wasn't that perfectly balanced, it could go in any direction of how my personality would have been, how I deal with problems. I think my dad was always very honor based. Everything's protecting your honor. It was like I mean, a lot of people would think it's like a macho thing, but it's really more of a respect thing.
Respect thing.
And respect is everything when it comes to him. So, and
Sure.
you know him, so that's how it is. And
Sometimes that's a limiting belief too.
it can be.
It happens to me too. Oh, they didn't respect me in my definition of respect,
Right.
so I'm mad at them.
Well, and that's why the balance is so important.
The balance is
that's
so
where,
important. To go, you know what? Like, try to empathize with people and go, well, it's fine. They have their own issues. Don't take it personally.
And I think that.
So you got both of that, would you say?
I think I'm almost an exact mix of both of them. It's
great.
pretty wild. And,
Yeah.
Alyssa, my girlfriend, gets to see, that on both sides. She sees it. She knows
Right.
what sides of me are which side.
Which is more? Are you more a tough, strict
so
kind
hard
of
to say.
dad, or an understanding, empathizing, flowing mother?
So
Kind of flowing, you know what I mean? Like,
Yeah.
you flow. I like flow. I'm searching for flow in my life, by the way. Like, my mom was flow. My dad is not flow. My dad gets upset. Honor, respect. How dare you? And then he doesn't talk to most people.
Right.
And I have that tendency to get really hurt. It's because he gets hurt because he thinks people should like be nice a certain way, and if they
Right.
don't,
Then
they're out. Whereas my mom was like, everybody's different. Let God judge them. Let the universe judge them. It's
Right.
not my job to judge. If I want to spend time with them, I do. If I don't, I don't.
I would say at younger ages, I was way more like my dad, and I'd say as I get older, it's much more balanced to slightly leaning towards my mom. I think that I had a much shorter temper. I had so much more to prove. I had, it was like this idea that you build up in your head of how your story has to go. And I think that as time goes on, I've become more measured, more patient, and I think of it's almost like when you look at a circle drawn on a piece of paper versus looking at a sphere. You're seeing way more dimensions to the same thing. And
Well, I like that analogy.
yeah, I think that's
You're
probably
you're growing.
Yep.
More layers. I relate so
For
much
sure.
to you, by the way. Not to make it my story, but like I feel like I was definitely more like my dad growing up, trying to be like him, trying to please him, getting into a lot of fights, defending my honor at all costs, proving I'm a man at all costs. What? You just look at me funny? Well, I better
This is
step
my
up.
hill to die on.
I better step up. It's my hill to die on.
Right. Yeah,
And then as I got older, becoming more like my mom, like, wow, that's not healthy for me. Through emotional intelligence, actually, through learning about emotional intelligence, becoming more like my mom. No offense to my dad, but he's on that, like, old school, gets people in trouble. So that's interesting that it's like the
So
layering
I would
of.
say that's one side, and the other side, when we incorporate Infinite Motive to that, is I started Infinite Motive in, I want to say 2010 or 2011 as an idea of like a streetwear motivation brand with a friend at a hookah bar. This was like
What does streetwear mean to you? Is it skateboarders? Is it?
I think it could be a mixture. When you look at things like Obey or the Hundreds, or like trying to think of like what would be big right now.
Like, what separates it from other styles, would you say?
Probably more graphic driven could
Okay.
be part of it.
Okay.
But not even necessarily just that, because a lot of those companies started to, fall in with the whole little emblem, and then the clothing itself is representative of the brand. But I would say when you trend spotting, when you see like what famous people are wearing, it a lot of times it has big graphics on it, or embellishments, or sewn on thing. I mean, there's so many different things, but basically it was our idea of how could we, at the time it was how could we make money off of what we think we can do. And I had my graphic design, he had connections at the time supposedly that were going to come through. It all fizzled out and it never worked out, but it was my first experience with it. I actually went through, I made the designs. I went to a printer, got them printed. Well, no, we bought product of the shirts, then went to a printer, got them printed out, did that whole process. And so as much as it didn't work out at the time, it didn't feel like a waste because it was like a learning experience. And it was the birth of that idea. And then, of course, that disappears for a long time. But when something like what happened with me happens, and I look at what my skills are and what I can bring to the table, and then the perfect storm of realizing that there's zero fashion in cancer awareness, I mean, it feels like it's a hole that needs to be filled. And I feel like I'm like a perfect storm of a situation to make that business happen.
Everything kind of came together too, like your background as a graphic designer,
right?
Then going through what you went through, like it's amazing how it all kind of.
That's the thing is, I think about, okay, like, could somebody start right now? They could see mine and be like, oh, I'm gonna start the same idea. They could, but they can't. First of all, they don't have my mind, so they can't make the same designs I'm gonna make. But they also, it's so many things have to be in the right. They'd have to have been a survivor of some kind of, or their parent or whatever, and they would have to have the idea to start creating these, and the wherewithal. Like, I look at the amount of work it took to just start what we're doing, and we're not like anywhere near where we want to be, but it's a lot of work. It's like, it's a process.
And also, there's a lot of check boxes to check to be successful as a business. I've seen a lot from the corporate side and also working with small businesses, and that's why, like, when I work with somebody, I really now, as much as I want to help everybody, I know that if I want to actually, for it to be successful, we have to check like a lot of boxes, and for every business is different. It could be 7 boxes, it could be 10 boxes. Like, do they have for example, do they have a real story?
Right.
Not just for the story part of the brand, the story part of, are you inspired to stick with this shit? Like the whiskey, the reason I bet on that with all my time and energy is because I'm like, oh, Troy will never quit this. That's why I would bet on you. Right. It's not just the brand. The brand can evolve, right? The what you offer can evolve, what you do. But, and investors look for this too. Investors will never invest, the smart ones. They all were asking, I need to get to know the team. Are they really passionate about this? Because they're gonna spend all my money in the next 2 years trying to start, and then they're going to quit because you're going to get plenty of reasons to quit. I'm sure you already have. Oh, this doesn't, oh, this brand, oh, the logo, oh, the website's still not done, oh my God, it's going to cost too much, we can't charge that. So many reasons we could have quit. The whiskey and every company I've ever been involved with, the reason they don't quit, they have a real story that inspires them. They have like a team, really good team that it has talent, passion, and purpose. They have a why. That's a big one now, even for investors, not because they care about the why, they care about their money. And if you don't have a why, like I said, you're not going to give it your all. But you also have to have all the other stuff. Is it a real brand? Do you have a real business model, right? Is it profitable? Like, are you selling for 20, making for 30? Like, do you have a marketing plan? How are you going to grow, right? Blah, 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 all this stuff. The point I'm making is you check all those boxes, so the rest is just executing, and it's going to be a long, difficult road, and that's why you got to be passionate about it, because you're not going to want to do it. You're going to go, that's why you shouldn't be scared of anybody, and welcome. Wow, another cancer brand is doing beautiful.
Yeah,
hey,
competition.
Hey, you're going to have your own logo, obviously. I'm going to have mine. I'm going to have my own voice. You're going to have yours. Right. You can even do t-shirt things because you like how we do it. Because really, we're not going to be able to serve everybody. So wherever you're marketing, you're going to get your sales. Wherever I'm marketing, I'm going to get my sales. 100%. Some people are going to just like your face, and some people are going to like my face. And some people will not like my face, and I'll be like, hey, there's another, don't let me stop you because you don't like my face. Right. There's a dude, Ted, doing the same thing, and he's got also all the check boxes like me. Yeah, like you said, story, brand. So, yeah, I'm just telling you to encourage you, because I know we all think like with whiskey, you know how many people told us, oh, there's too many people in whiskey? I go, it doesn't matter. He's a whiskey guy. Yep. Oh, there's too many people trying to be actors. It doesn't matter. Are you an actress or not? Are you an actor Smurf? What does it matter that there's other 99 actor Smurfs? Right. Not to mention 80% of the actors, merch, brands out there are not real. They don't really have a story. They're just trying to make a living. Right. I don't blame them, but they're like, I gotta feed my family. Let me sell let me go buy some T-shirts and sell them. Let me go make this. Let me go start a nonprofit. Sometimes the nonprofits don't have real.
A lot of
I
times
work
they
with them, and like I go there, and I'm like, because I'm not gonna ever make anything either. Why would I invest my time in like, I know it's a short run. They're just trying to make some money, and then they're gonna go to another business. So all these things you have to be aware of, because that's what's gonna drive you, man. Like, you just got to keep executing.
Yeah, I think this is no matter what level of success we achieve in 5, 10, 20 years, I don't see this ever going anywhere. This is always going to be what I'm doing.
Yeah.
So,
That's important, dude. I was going to ask you, like, what do you see in the future? What's your vision board? Which I'm happy to work on at the tail end of this podcast, either as part of the podcast. We can film it. But what's your vision? Just tell me.
For me, it's being able to have risen to a popularity where we can truly start changing people's lives.
So, if I may, give me like specific visions, even if they don't come true, but we would write it on the board. Like, I want to have 50 million followers. We want to have a $10 million a year revenue number. And let's say we make 20, 30% profit, donate some of that, and then we have 2 million every year to support 10. I'm just saying, like, those real
I wish I had
visions.
it mapped out to that extent. I want it to be. I mean, the most we've discussed anything like that is I want to have tickers on the site that are counting how much has been raised for each type of cancer, and that way it would be like this live representation of the change that we're doing. As far as, I mean, I would obviously love for it to be a multi-million-dollar company. I want it to be at events. I want to see my logo on a UFC octagon. I want to see.
Yeah, give me a specific, how many dollars? Okay, if I'm coaching you, I'm going to make you answer this. We don't have to do it for the podcast, but why
I can
not?
give you a theoretical.
$3 million, $5 million, $10 million.
Yeah,
it's just a vision. Yeah, you want to generate
50 million.
$50 million in revenue. In how many years? Just guess.
Oh, I thought this was per year.
No, but when are you going to get there?
When do
next
I get
year?
to?
Are you at 50 million next year, or in 5
say,
years?
I would say in 5 years.
5 years.
Yeah.
What about next year? Just curious, just so we have a 1 year vision.
I would love
board.
to just be in 6 figures next year.
In 2025 calendar years,
yeah,
you want to be at $100,000 plus. Maybe you'll be at $1 million. I'm not limiting. It's just very powerful to put real numbers out there. It's just like what companies do. They put budgets. They don't know. They're like, they kind of know, because they're like, well, last week we sold this. Let's say $60,000 this week.
Right.
And magically they hit those, because we're competitive. So the salespeople go, I got to call some more people. And they know they're faking the numbers. There is history, but they don't know what's going to happen. They might get a big account. They might put numbers really high to drive people toward it too.
Yep.
And often you get right around that number magically. And if you say only 100,000, you're limit. But that's good. That's a good number.
Yeah.
So I feel like you shouldn't do something.
My vision for it is that if it can make it to 100,000, it can make it to
exactly
any number.
So 100 revenue. Still not a lot, but that's year one.
Yeah.
2025. Can you do that this year? It's March.
So
hard.
It would be really what it's going to take is a real trigger of eyes on our website.
How would you? But if you had 100,000, if somebody put a gun to my head, let's use me as an example, and said, you got to make $100,000 this year, I'm fucking blowing his head off on 12/31/24.
Right. Then I would be
Rick's
immediately opening.
What would you do?
It'd be social media ads.
Social media ads.
100%.
We don't do that now.
We don't right now because I'm having a problem with Meta. My account's restricted, and we don't know why.
Oh,
so
okay.
We're currently
temporary.
Yeah, I would assume. I can't imagine it.
But by June, you could start doing something.
Yeah, it's really just a budget of being like, all right.
How much do you have to spend? Because that'll drive your revenue essentially.
Not a lot.
I can help you with advisory at minimum. After that, I don't know, but let's talk. Why not? Let's get into it.
Yeah, I mean, I know that for when I was working at V-Shred, I know that the numbers I was doing a day as just one media buyer amongst 4, let's say, for it to be successful to where we're at 6 figures, I could cut that down. I would say I would need to spend 5,000 a week. I would say 5,000 a week on ads would probably get me a return that would be close to 6 figures for on the year.
Right, because you have 40 weeks left times 5,000, so that's 200, or that's, what is that?
It's 200,000.
Yeah.
But then I'm thinking.
But if you're making the revenue, then you just put it back in.
Right.
So.
No,
No, that's not right. Yeah, that can't be right.
Yeah.
You got to take it back. But you should run the numbers and do it.
But you could half that, right? So 2,500 a week.
Yeah. All right.
Yeah. Which is still, I mean, it's not small money for something that's just starting, but it's also
per week though. That's a lot.
It's a lot, but
4,000.
This is me cutting down just for understand. I was running $100,000 days.
Well, let's say you have 6 months left in the year because you're gonna ramp up. Let's say 6 months in the year, and you want to get to $100,000. So you need to sell like an average of 20,000 a month, right? So if you want to make 20,000 a month, how much do you need to spend that month on advertising? Just in the month. You should spend probably 3,000 to 4,000, like 30, 40%, 50% is very aggressive.
Yeah.
Oh no, you need 20,000, so 6,000. Yeah. So if you spend 5, you might be able, if you spend 5 a month, you should be able to get to 20. Maybe 7.
Theoretically, yeah.
I'm just saying most companies spend 30, 40%.
The other thing is like, of course, kind of troubleshooting how you're running your ads. I know that there's a lot of automatic placements and stuff now. It's been a while since I've personally ran ads, but I know that you're basically leaving a margin of error or, like wasteful spend on ads that aren't working, and then you're trying to expand on ads that are. And,
right.
There's going to be some
spending you're going to
lose some before you.
And in the beginning, you don't spend that much. You spend a little bit because you're experimenting and you're seeing what ads really work, the A/B testing, and I'm not saying try to get to 100. I'm just saying that why not? Like, you should probably, like, if you want, maybe after this, we can cut this out too, but I just want to be helpful. Maybe after this, why not, like, also problem solve stuff that could get you faster to where you want to be. Yep. And then, like, part of it is like setting like real goals, and then driving toward those goals, and then reverse engineering those goals. Like, okay, how do you get to $100,000? What do you need to spend per? And then now that you know what you need to spend, you got to prepare for that. Do you have that kind of backing?
Yeah, that's the thing. I mean,
well, you start with like
I guess right now,
1,000 a month, I think, or 500. Like, you're experimenting for the first 2 months.
At least
probably.
Test it out.
You need data.
Yeah.
So the first 2 months, you're not making 20 grand of sales because you don't even have the inventory. You're starting slower, but you ramp up toward maybe 10,000 a month.
Inventory we actually have for pretty fast expansion because it's print on demand. So it's basically a warehouse of this is all sitting.
Yeah.
And then they print it only once somebody orders it.
Can I ask you about numbers, or we should do that off camera? Like, how much do you sell?
I'm not even sure. Like, we'd have to look into it.
Yeah, we'll do that later. Because you have to think, like, what are you selling it at? What does it cost? Delivered.
Yeah, the thing about print on demand is it cuts.
What's your profit margin?
It cuts heavy into your profits, but it's the convenience of having it completely third party.
But that's a big deal because now
But they do all fulfillment. Yeah. They do everything.
Now you can't spend as much on ads to stay profitable. That's all. Like, you might be spending 80% of your revenue on all your costs, right? Like your manufacturing, delivery, whatever else, graphic design, paying people for stuff, and now you got 20% left to spend on, give it to yourself or spend it on advertising, let's say. Unless you go negative, which is fine. Most companies go negative the first 2 years.
Right.
So if you really want to grow and you really believe in it, I would say don't even worry about profitability. Let's create a budget for you.
Where I'm at, yeah.
I would do a forecast for you. That's a guess, just like we did for whiskey, that we ended up getting pretty close. I'm telling you, like, I'm a good guesser because there would be driving factors. And then you end up, again, like almost creating like self-fulfilling prophecy. Yeah. You set 100K. and you have that on your whiteboard every day, and you're like, oh, 100K, shit. So
What
how
am I
much
doing to get us there?
what am I trying to get to? I got to get to like 30K a month by 6 months from now for it to average enough for,
Yeah,
So
I
then,
think exposure is our biggest issue right now.
yeah.
And we're
Getting
not-
what exposure?
Yeah.
And I
exposure
feel like
and
you're just
converting-
about to
and
erupt.
converting. Yeah, we're not
You-
converting what exposure we do have.
I would say if we have a coaching session, we can come up with like, you're about to explode, in my opinion. Like, I feel like it's just a matter of you not holding back, doing this podcast, telling your story, making great. There in this podcast, there were like at least 10 to 20 to 50 amazing clips. I'm crying to your story, all natural. You talking in the beginning about the whole thing where I started crying when you guys were over. Then, you coming in and me, I was feeling you guys a lot. I was like, oh my God, like your child at such a young age. And you could be thinking everything's perfect. And you guys have such a great life. And to be like sidetracked, like, wow, what a journey you guys have been on,
It's
man.
another
But I think
it
like
was-
if
this
you
was
really
great.
want to make a run at it, dude, like let's maybe talk a little bit about the business side and just, and I could also help you like push ahead, like do the live, I'll moderate that type of little things to get exposure.
I think the lives are going to be
Yeah, huge.
just because there's nobody.
Yeah. And then interview Lori. I think,
Yeah, I think that'd be
honestly,
good
we're
too.
here if you want. I can go forever. We can go
Yeah,
eat.
I just want to make sure everybody's.
No, let's eat. We're
Yeah.
gonna stop right now.
Or
We're like 2 hours away from eating.
2 hours.
Oh, we're good then.
An hour.
Oh, so we're not even rushing.
Oh, no.
Oh.
I'm starting the grill right now.
Cause and Gino would be really interesting too. But I think
I don't know
separate.
how open he is to it, but yeah.
Yeah. I would love to interview Lori too, because I think that would be an amazing interview for me just to talk to you about it as a parent.
Darling, you know what to say, right? You love your
Right.
husband more than
Exactly. Say all the right things about the hubby. And then Gianna, if you're down too, and you can be in full control, you can be like, don't fucking post that shit. And I'm not gonna. I'm gonna give it to Sonny. He can post that shit without your permission. What are you gonna do about it? You gonna sue him? I'm just kidding.
I would never.
I'm gonna give you
I'll give you everything, bro. I'm gonna give you everything.
Anyway, I think
Yes.
that was great.
Yeah.
I think there was a lot of.
Oh my
quality
God, dude.
content in
Yeah, dude.
Did you guys
Anything else you want to say? Anything else you wish people knew about you that you feel people misunderstand about you, or you wish they knew about you, or your story?
I wish people knew about
Yeah,
me.
maybe not. Maybe you covered it all. I'm just trying to ask that, especially because my podcast is Yeah, I'm just a man. I don't know that's
misunderstood?
that's been misunderstood. Is that a song?
Yeah. Oh Lord, please don't let me be misunderstood.
Is that a new song or an old song?
I'm just a soul whose intentions are good.
Yeah,
Oh
right.
Lord, please don't let me
man
be
that's,
misunderstood.
Dude, I need to play. I don't. Can you play that for us?
Yeah, you've heard it for sure. I know.
Played on my penis.
We'll cut
I'd
that
like to
out.
see that. They get stretchy as you get older. He's like, no.
It doesn't.
It's not that stretchy yet. Yet. That doesn't mean that's your size. That just means you stretch. This is for the archives.
Yeah,
this is
this
for
is-
the what is it? OnlyFans? Or what is it?
Or
The
Patreon.
Patreon, yeah. OnlyFans.
You do it on OnlyFans.
Oh, I didn't tell you that there's an OnlyFans portion of this show? I'm mixing
Bring
it
'em
up.
out.
Bring them out.
Ray Romano.
Yeah, you should check out Ray
It's
Romano.
hilarious.
Yeah.
Ray Romano, the guy
Oh, Who Loves Raymond?
who loves Raymond.
Yeah,
Yeah,
she
so
did a
he has
stand-up,
a
which is
stand-up.
20
Oh, Ray is
He
great.
did like first time in 20 years,
Yeah.
and he talks about.
I think it's on Netflix.
Old man genitalia.
Yeah.
What happens.
Oh, I'd love to see that.
It's funny, like there's.
My favorite topic:
It is a good topic.
stretchy penis.
Yeah.
It's a good place to end off on the.
Just a tip.
Yeah.
Sorry.
Just a tip
Just
of
a
the
tip. Oh man. Well, we can
Where's your
cut some of that
brother,
out. I don't
I think
know.
they might have came. I saw somebody in the window, but I didn't know who it was. I don't know if they just came here or not.
Huh. So, anything else you want to?
Is there anything else?
Yeah,
I
I'm just milking it out of you at this
Yeah.
point. We can end it. I feel like, honestly, I would even post the whole thing because some people would just want to get to know you, and even the penis joke, like how you handle that. Like, I feel like that is getting to know you.
Yeah.
Yeah.
You didn't say anything. You didn't say stretchy penis. I did.
We'll play it by ear.
I'm all about just,
But I
hey,
think
telling
right
your,
now it's
showing
getting
yourself.
pumped up and used, for posting.
Sure. Oh, the clips are the key. The
Yeah,
clips.
That's where it's at.
But I'm saying YouTube, now even Instagram, now even TikTok are going toward long form content. And now everyone's saying, oh, like 2-hour interviews, nobody does that. There's only a few, and then it's in high demand.
Yeah.
So I think don't edit anything. Like, find the beginning, find the
And
end.
then just
I
Post
definitely
that.
think for YouTube, it'd be great.
Yeah,
Yeah.
post that whole 2.5 hours, whatever, us chatting, whatever we're doing.
Yeah.
Then you're gonna make a lot of clips. I feel you can do a lot of clips about your story, who you are. That's what anything else you want to say. This could be a clip, like a memory, a fight you got into as a kid. What was the most challenging thing? Like, there's a lot I would still ask you. I just don't want to keep. I mean, I don't want to like drag it out.
Just like, the
But, like,
whole survivor-
who are you?
survivorship anxiety, which I think is huge, and what you're going to be speaking to most when you do your lives is
Yeah, dude, the aftermath.
You spent a whole summer sick, more than a summer sick.
yeah, it's
The testing, the not knowing, just dealing with all that.
yeah. I would say along the lines of that would just be that you're always going to question everything, and every time you get sick, you're gonna wonder, especially if it lasts longer than it typically should. You're gonna start to have some anxiety about getting a blood test to make sure, like before we went on the cruise, I decided to get a blood test because I kept getting sick, and I was like, man, if I'm on the cruise and things get out of hand,
Yeah.
I'm in a bad spot. And I think that it's you never get away from it. It's always present every day. You might not think about it at all times, but there's
Sure.
never a time. I mean, when I get up in the morning and I take my handful of pills, or I'm injecting testosterone, or there's things that your body permanently is going to need for life, and for it to not cross your mind at some point throughout all of that's impossible.
Right.
It's part of it.
Well, to go back to the analogy of being like a military prisoner, being tortured, and having post-traumatic syndrome,
Right.
when you get home, it's only in your nightmares now. But you literally, it's still here. Like, those people can take you at any moment.
Yeah, it feels real
Those
at all
terrorists
times.
can kidnap you at any moment back to that prison, or that hospital, and they're helping you, so you can't even hate them. You're like, thank you for killing me. Thank you for torturing me right now.
Yeah, yeah.
And that
It's,
could happen at any moment. And so it forces you also to be like extremely strong-minded at all times.
It does, and you have to be able to kind of let certain things not take over your minds when you start getting these negative thoughts, because it can really, your mind can run with it.
Yeah.
And that's where you're going to get a panic attack, or sleep's a whole nother animal. You always have issues with, or at least I have a lot of issues with getting sleep, deep
Why is
sleep.
that?
I mean,
Physically or mentally?
I
Anxiety
think
or-
it's both. I mean, I know I have sleep apnea. I know I have issues with like bad dreams a lot. How much is attributed to treatments versus
Right.
everything else? It's hard to say.
But it's changed.
Yeah,
It
for
feels like it's impacted.
Yeah, there's that. There's the fatigue that you feel is, I think I'm bounced back tremendously from where I was, but I don't feel like I'm 100% as far as that goes. The fatigue, I get tired pretty quickly. I luckily this point in my life, I'm not living as crazy party life or anything like that, so I don't test it too often. But when I do, I feel it, and
Yeah.
I get tired quicker, more quickly. And and like I said, I'm 33 years old, and I have congestive heart failure. I have a thyroid that doesn't work. I have, there's things that are
all from the
all
effects of
yeah.
chemo.
And these are things that I'm going to deal with forever.
And those are the medicines you're taking for those things, or
Yeah.
anything else?
Yeah,
For things that kind of started failing because of the chemo,
Right.
because of how
it impacts your
how
organs.
much you had to drive your body to what is it called? Nader. Nader. Oh, Nader, like tomato, like in Cars.
Nader.
Ralph. Oh, is his name Ralph Nader?
Yeah. Well,
No,
I
no,
mean,
no.
it is, but it's spelled.
Mater. Oh, he's Mater.
Oh, you're talking about in
Mater,
Cars.
yeah, Cars.
Mater.
No, Ralph
Yeah.
Nader was the neighbor. Yeah.
But yeah, it's just there's a lot of aspects that you have to live with forever. And
Right.
That's just
And
part
that's
of it.
part of the misunderstanding you were talking about, part of the survivorship anxiety that
right.
people don't understand, and they think you're fine.
Yeah.
Because
and
you
you'll
came
get it all
back-
the time. Oh, you're good now. Right?
Oh, you're good. You
now.
survived, and you're a survivor. So that means you're good now.
Yeah.
So it's like, what are you
all good.
complaining about? What's the problem?
Right. Exactly.
And you got to always be up, because if you go, oh, I'm just really tired today, they go, oh, God.
And the social side. Of
Oh,
things,
God, sorry. But they don't
It's-
realize you're still going through it.
Everybody shows up for you when you're right when nobody knows if you're going to make it or not. You will see the most interaction on your social medias, on everything you've
Yeah.
ever had. Once you're making it or going to be okay, so to speak,
Yeah.
no, people fall off that you never thought would have fallen off. In this process alone, I lost 2 best friends that just randomly stopped talking to me.
After you survived.
Yeah, or in the middle of treatment, but yeah, both.
Why? What do you think?
I think
What
that
do you
it's,
think
I think
happened
it's
to them?
easier to disconnect and not have to deal with any of it than and I think the
Because
initial
you're okay
the initial
now.
outpouring is because everybody loves to feel like they're,
Sure.
morally good and,
Helping
know,
the sick,
exactly.
the sick friend.
But once that passes by, it's not sexy, it's not cool, you're not getting any credit for supporting that anymore. It's the
Yeah.
same thing with my social media. Everybody showed up and commented when I got cancer.
Yeah.
I started a company for cancer awareness.
Yeah.
You didn't see all my followers from my page show up on an Infinite Motiv.
Right.
Why is that?
Right.
It's much easier to do your virtue signaling of how much you care about somebody in a comment
Yeah.
and liking their photo.
Right.
It's way more to follow their page of business and support in any way.
Sure.
And that's just
But
you
it's
know,
to be
that's-
expected.
It is. Yeah.
And
That's just
sometimes
how it
it's painful, but it made me think of my own experience when Ben was born.
Mm-hmm.
Outpouring, but then somehow people weren't there when I said, hey, like, I'm going out of town, check in.
Right.
That's how it is. It's an unfortunate truth.
It is.
And that's
It's
why
painful.
the people that do stick around
Yeah.
you and support you are
Right.
priceless. I
It
mean,
highlights
it's-
how important the tribe is.
Yeah.
You know what I mean? And the tribe is different than the circle of friends or the circle of people in your life.
Right.
And I'm learning that more and more. As I get more and more hurt by life, I realize, oh man,
a lot of passing
like this
through.
last thing that happened to me, I'm never gonna I will let people in. It's not that, but not like I did.
Not
And,
so
and I
quick to
realized,
trust.
yeah, because we go through seasons, and I don't know you yet. And tribe is a different thing. I realize there's people that, even close to me that may be surprised to know they may not be in my tribe.
Yeah.
Like if the apocalypse happened, would I let them in? Would they give me up? There's a Jew right there.
Exactly.
I'm just saying, right?
That's,
or whatever. They're just not that type of person. Like you guys are my tribe. Just
I think it was
FYI.
Jordan Peterson that said pessimism.
But it's a
is
character,
the-
right? It's like a appreciation. People that usually I realize they appreciate. Like you see common traits that I've noticed, and for everyone it might be different. But you got to be, and the tribe is a special thing.
It's irreplaceable.
Yeah,
I was just going to say that I think it was Jordan Peterson that said pessimism's the first step to wisdom. And I think that that's what it is. It's like everybody gets that first feeling of just like negativity and like willing to just throw it all out. And then if you don't get past that, then you don't get to the wisdom. But it's the first step to getting there, is just realizing it's not all, sunshine and rainbows.
right.
And then so you experience that.
Yes,
And if you don't get past that, then you become that victim that I'm talking about.
Right.
Because everybody's just out to get you. You're,
right,
of course this happened to me.
right.
It's an impressive vehicle.
Out to
whatever
get
that was.
us. Out to get us. It goes back to even just solving problems in general. Logically speaking, when you solve a problem, let's say, math problem, you got to write it on the board. You have to acknowledge a problem exists. We're missing an X, we're missing a Y.
Mm-hmm.
So you can't be like, oh, no. You got to write it down. You got to look at it. You got to go,
Sit with
wow,
it.
what's going wrong here?
Yeah.
What are we not seeing? What could the solution be? And then it's the first step towards solving the problem first. You know what I mean?
Yep.
So, yeah, the pessimism, the realization of, fuck, this could potentially be shit. How do I turn this into fertilizer and grow something?
Yeah, at V-Shred,
That's another shirt.
One of the owners of V-Shred used to say, turn shit into sugar.
Yeah.
That's pretty much what
Well,
it
I've
is.
been kind of saying, like, because I like this better because I don't know if I can really turn shit into sugar. And then it's like, well, how are you going to do that? I know mentally, I
Right.
get it. But turning shit, let's say you have a big-ass pile of shit. You can go, oh, my God, there's a big pile of shit in my life. God damn it. Or you could turn it into fertilizer, literally, and grow something.
It's true.
I love that because it's really, you're actually using the shit, not metaphorically.
Right, literally.
Physically, literally, even literally, you can turn it into something good. And life is like that. When the shit is there, don't be like, oh, I'm just in shit. Oh, God, pour me in. Just sit there in the shit and smell it and take it. Turn it into something. And once the flower goes, at least you get to smell a flower. Right. You might still be in some fertilizer, but it's much better than just sitting in shit.
That's right. It's, we're all sitting in some kind of shit.
Yeah.
It's
All
just
of
how
us
you look
do.
at it.
Either mentally, physically, or usually both. All of us. We all have our challenges. Some seem greater than others, but from the greater ones, you learn the
That's
most.
another
man.
challenge I experience is I don't like to use my comparison of experience with everything that everybody goes through, but it's a battle that I have to go through internally because it's like in my head, of course, it sparks up. It's like you're complaining about nothing, like,
Right?
Like it's not really. But if I'm the guy that's always going to be like, oh, I had cancer, and like, why are you like? It's just you have to battle with not using that in every situation. It's not.
I have a perspective shift for us because I'm the same way. I don't like complainers, kind of,
Right.
because I want to get to the solving. But here's a way to look at it, and it goes back to what we just said. Everyone's got their shit.
That's right.
And you could actually make a case for everyone's got the same amount of shit somehow. They've either turned it into fertilizer or they're just sitting in the shit, but they have their own shit. And people that are complaining, that's part of their shit. It's like, wow, I feel bad for you.
Yeah.
Because you're just sitting in the shit and you don't realize you could be turning it into fertilizer with a little added ingredients,
Yeah.
right? Go to Home Depot. I don't know, throw
shift
some
your perspective.
fertilizer juice on it, whatever the hell you do to make shit into fertilizer. Put some seeds in that motherfucker, right? And so my point is to not think of it as like, oh, shut up, I have more pain than you, to go, we all have the same amount of pain probably.
Right.
Because your experience also alleviated so much future pain that it's going to offset. People that haven't been through that, the slightest thing throws them off.
Yeah,
They're like,
it's true.
oh, it's raining today. This is terrible. And they literally are depressed because they make themselves that way. Now, instead of us going, oh, God, we should say, wow, that's so sad. That's what they're not dealing with chemo, but that might be worse.
Right.
Would you rather have dealt with chemo or had that infliction?
Right.
Where you're like, oh, I'm such a victim. This and this happened to me. I can't get a job. I don't have this. Instead of like,
Especially
hey,
waking up as an old person, having not done anything and just complain the entire time. Because then it's like, it's too late for you.
you
A
can
lot of
survive.
times.
Yeah, you can survive chemo potentially, but that is an infliction. You're not really doing it. You're not really living.
No, your mind is poisoned.
Yeah.
And you just never recover.
So the point is like to not think of it as like, hey, I had worse suffering than you. Don't complain. Think of it as that's their suffering.
Right.
And it's just as bad as the chemo, in a way.
In a way, yeah.
Not to mention, it's easy for me to say, but since you've been through it, it did give you, like, you wouldn't choose it, but it has offset a lot of your current and future problems that if you hadn't gone through it would have impacted you way more. It's almost like you got all these bonus points, right? Now,
Yeah.
but for the rest of your life, you got to deal with this. How do you feel about that, Sonny? How do you get okay with that? It's part of your journey. It's part of your mental strength.
Yeah, I think it becomes more of just you don't have another choice, so it goes back to kind of making that choice of how you're going to perceive it.
Right.
And, I could sit and complain and always be upset about it, or I can just make the best of it. I think it makes me focus on my health way more
Right.
than maybe I would have. Who knows?
Yeah.
Anything could have happened. So
You could have got hit by a bus.
Right.
If you hadn't gone to chemo this one day in particular, there might have been a bus with your name on it that you just didn't see coming. You're jogging. You're thinking life is great. I don't have shit
Well,
to
and
deal
that
with.
could still be the case. That's
That-
the other thing.
right.
It's like every day is that.
Exactly.
And I don't think enough people think about that on a day-to-day.
Right.
Because you end up in some, argument, and you're not talking to somebody, and now you're, there's like this weird energy.
Yeah.
And what would you do if you lose that person?
Right.
You're going to always, for the rest of your life, you're going to regret
Right.
that you spent time angry instead of, loving each other.
Right.
And so
You live for the
that's
now
always-
more.
Yeah, for sure.
So I've been saying this to people recently because I've been sort of realizing it more and more. And as I get older, you also know your time is limited. I only got so many summers left. As one of my friends told me recently.
Yeah.
Damn, I just lost my train of thought. So many summers left. Oh, being in the now. And that is that I'm really starting to understand more and more. And when I say understand, like really embracing it versus just knowing the idea of it. That yesterday, that it's only now. You know how people say like
the
now
only
is
thing
all
that
that matters.
exists,
Now is all that exists. We've talked about this. Because yesterday is gone. Like it's already happened.
don't
You
have
can't
tomorrow.
change it. You can't change it. It's written in stone. You can learn from it, but you can't go back. You can't even relive it, maybe in your memories, right? So yesterday doesn't really matter. Tomorrow may not come. You don't know how many tomorrows you have.
Right.
And more importantly, you don't know if any of the tomorrows you do have is going to be better than today.
Yeah. It's true. There's
Today could be the last day I'm cancer free, for example.
right.
Tomorrow could be the day I go, God damn. And I'm not saying that's going to happen or, but
But
it
there's
could, it
people having
literally
that
could
day
happen.
right now.
Right. And so again, whether you're in whatever it is now could be the greatest day left. Like always live for today.
I think it's 4 people per minute getting diagnosed with cancer.
Wow.
4 people per minute.
Yeah, I mean, that was the wild thing, right? Sonny goes into the hospital, and he didn't come out for a month.
Yeah.
And not only that,
Came in for a
he never came
checkup.
back to any kind of life remotely
Yeah.
even close.
He left
Lived
that
in
life
another
completely.
city,
Right.
Nothing around him other than his family.
Right.
Yeah,
Was
we were
anything.
living.
You
as
want to have a
squatters.
seat? Maybe we should add Lori to
I-
the couch.
I have to pee so bad.
Let's take a break.
Yeah, let's take a
Let's
break.
take a pee break. Or maybe you go and Lori's going to sit down.
That's also an option.
Instead of like
Yeah, let's do
allowing
that.
her to escape potentially later.
Yeah. Okay.
I can
Yeah,
still
let's
go.
do that. All right. Well, then
Let's go like 30
that's
minutes.
closure for me. You're gonna get in. I
Yeah.
appreciate it.
Yeah,
It's
dude.
been amazing. I think it was much needed.
Amazing
and I think
conversation.
much more put together than our last one.
Oh,
So
yeah,
I
dude.
think we really got what we wanted.
Yeah, dude. And I was going to comment just as a last thing, like, I do sense, I don't think you change that much as a person. I mean, you've gotten older. We all evolve. Of
Right.
course you change, but like your core. But I do sense this, like, calm about you. Like, you know what I mean? Confidence, calm, a knowing. And that is definitely like such a valuable thing, right? To be able to live your days knowing who you are, like you said, in the worst times. Such a gift.
Yeah.
Because
Well,
people
'cause
go
it's a
their whole
question
life,
for
yeah.
everybody.
And sometimes you go your whole life. Like I feel like I'm still grappling with that. And that's my pain. Maybe if I had gone through chemo when I was younger, I would have figured it out sooner. Seriously, I'm just saying. As just a positive spin to you having to go through it.
I
I'm not
understand.
encouraging me to get it or hoping I get it. No. It's scary to go, oh my God. Like my buddy, I told you, the CEO of a biotech company that studies cancer, he's one day older than me. He just turned 50. Was running a freaking triathlon. He's super fit. Way more fit than me. I'm like killing my body after And yeah, went to the hospital for a checkup, and they're like, "Oh, you got like some rare cancer that was attached to his heart and arteries." He had to go through immediate chemo. He had to quit being a CEO. Like he's still kind of on the board. He's taking a leave. He's like, I can't be clear-minded for my company, you know. And it's such a great story though. Like I want to sit
Have him
down with
on,
him too
yeah.
and talk about his like origin story. And even before this happened, I was like, dude, you are such a superstar. You need to tell your story. Like you're raising money for your cancer research, like for rare cancers. His is very, very rare. He went through chemo. It went really well. He got surgery. I told you, long, like 6 or 7 hours. Like they had to go in robotically, clean out 80% of it, but the robot couldn't get enough, so they had to open him up.
chest, yeah.
That was optional. They didn't know, but once they did it, they're like they opened him up that day. They didn't think they were gonna do it. I probably shouldn't even talk about this without his permission, but
Changed his
I'm not
life.
saying his name, but I'm just saying. And then they cleaned it out. I think it really went well, and he's just. Friday we're gonna go grab lunch, man. I haven't seen him since the surgery. He was like, like going through. It went a little slower, the recovery. So I'd love to tell him also
Yeah,
about your
definitely.
company.
That would be
And
awesome.
I've been meaning to order something, by the way, but I just too disorganized, honestly, to do it. Like a
Whenever,
hoodie
yeah.
or something like that.
Gotcha.
Maybe if you have one, I'll buy one and wear it on Friday and be like, hey, maybe. Because he's like in the world, dude. He's in
Yeah,
cancel
he's-
culture,
right.
and he's an amazing person.
That's the kind of person that we
Maybe
need
you should go
for
with me.
connections-wise.
I'm going with Ben to meet him and his right hand person. She's amazing. She's like his chief of staff
Okay.
that's been with him for like 15 years. She used to work for the 49ers. Yeah, she's like a
Well
champion.
connected.
But this whole he has a biotech company that
That's great.
they already have like medicines like for other things like I forgot gout.
Yeah, that's what you were telling me.
I was telling you, and then there's this cancer research. I don't know if it's for I don't know I don't remember the specifics, but it's to treat certain cancers through the skin, which is like
Topical, that's right, you were
topical,
telling me.
groundbreaking,
Right.
like topical, and it's a new technology that doesn't exist. So it could be like revolutionary,
Could be,
literally.
yeah.
That would be nice.
And he was on this journey, man. And then this happened, and now he's basically I don't know if he's gonna come back.
He can definitely.
He probably
speak
I
on
think
it
he
now if
assigned
couldn't
somebody.
before.
Yeah, he assigned somebody to take over. So he's probably gonna come back depending on how things go. But what a story too, like to help him also raise money because they need to constantly raise money for research. They were in the midst of I think raising money. I was telling him let's do a video of your origin story because you're such a superstar. I think you are too. Like he looks good, he speaks well, great voice. I'm like, bro, super personality, and he's a doctor and CEO.
Yeah, he
It's
needs-
like,
he needs
dude,
to do it.
you're like, you need to be like, and he goes, oh, you're probably right, man. I'm like, yeah, you need to tell your story and go, we're raising this much money, do a GoFundMe campaign. Like you have the charisma to do that, and you're not doing it. You can be the Steve Jobs of biotech cancer research. But now he's been through chemo, and he lost 2 family members in the last couple of years to cancer. So he has kids. They were like very worried, but
Freaked out,
very
yeah.
positive mindset. But they were like, "Oh my God, now our dad's gonna get taken."
Yeah.
But he made it through because it was like his grandma, I think, or his mom, and like close family had a grandpa or something
Yeah.
within like a year and a half. And then he got diagnosed within a year and a half, 3 people.
Unfortunately,
And he was like, my kids, he was, worried about his kids, obviously.
Of course.
So and now, I mean, he's probably still going to always have to be on top of it. Who knows what it's affected,
It's tough. All right, I'm gonna swap
Yeah.
out with you, and you can either pause it or keep it going, whatever you guys.
Yeah.
you can always come.
However you want to do it.
Should we restart? Let's restart. It's going to be big. Oh my God. Huge files. I have a way to transport it right away to you. But I'm going to restart this guy because I think it's pretty easy to do. Shit, that went to that select. Shit, I hope that recorded good.